Hello, everybody, and welcome. In today's video, I'm going to be showing you how to do an introduction from start to finish. This is Nurse Eunice, the owner of Florida Training Academy, and let's get started.
Helpful hints. Number 1, always knock on the door before entering the room. Number 2, wash your hands before touching the resident. And number 3, provide privacy by closing the door or curtain.
Come in. Hi, Mr. Lucas. Good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? All right, before I begin, let me go wash my hands and provide some privacy. Washing my hands. And now that my hands are clean, I'm going to remove this call bell. How are you doing today? Oh, that's great to hear. It's time for your vital signs to be taken. Is it okay if I start now?
Count the radial pulse for 1 full minute. If during your test you lose count, ask your nurse if you can start over. Don't forget, practice makes perfect. Practice on your family members, friends, and patients if you currently work in healthcare.
So after taking the patient's pulse, make sure you document. And if you need to watch a video on how to take the pulse, I have a video for you. Just look in the description area. So now that the vital signs are finished, I have to end my skill, and you want to end your skill with safety in mind. So anything that you have undone, you need to go back and redo. For example, if you lower the rail, make sure you raise it back up. If you raise the bed up to a working height, make sure you lower it. And in my case, the only safety concern I have right now is giving my patient the call bell and making sure that he doesn't need anything else. So here we go. I have your pulse and it was 78. All of your vital signs are fine. Do you have any questions for me right now? Do you need anything? Well, here's your call bell. Press the button if you do need me, and I'll see you on my next rounds. I'm going to open the curtain. I'm going to wash my hands again. Don't forget to document your findings. And guess what, everybody? It's that easy. That was an introduction and an exit with Nurse Eunice. See you in the next video. All right, so before you begin any patient care, you want to sanitize your hands. A napkin is not required when you are initially starting, but I like to use a napkin to turn my water on and to turn my water off. So you want a mixture of hot and cold water. You want to make sure your water is nice and warm. So let's test the water temperature. It feels good. I'm going to wet both of my hands. If you feel that your jacket is going to become an issue, you can take it off before you begin your skill, or you can roll up your sleeves. So now that my hand is wet, I'm going to apply some soap. Keep your hands lower than the elbow, ensuring that your hands do not hit the inside of the sink. If they do hit the inside of the sink, let your instructor, your evaluator, know that you've made a mistake, and she will let you know if you can continue from the mistake or start all over again. So I'm going to clean the palms, the back of an hand, the back of the opposite hand, in between the fingers, in between the thumbs, around the wrist, around the opposite wrist, and I'm going to go up and down every finger. According to current CDC standards, friction should occur for at least 20 seconds. So if you feel that you did not reach 20 seconds, go back and clean more. After my 20 seconds of friction, then I want to proceed to my cuticles and nails. You're literally going to clean around the cuticle and then clean under your nail. You're going to clean around and under every nails. If your nails are extremely short, you still have to clean beneath them. You just don't want to hurt yourself. So you would just do a simple scrape. But here I'm literally cleaning beneath my nail as if I'm trying to remove some dirt or debris. If you have long fingernails because you did not cut your fingernails down before your test, you would be scraping them across your palm. But remember, in most facilities, fake nails or acrylic on top of your nails are not allowed. You're now going to rinse the water, rinse the soap off of your hand utilizing the water, remove all soap suds, and once all the soap has been removed, use a napkin to turn the water off. Do not compress this napkin because if you do, you're going to contaminate your clean hand with the dirty napkin. It's the part that just touched the faucet handle. Discard the napkin. Whenever you are drying, hold your hand lower than your elbow and pat dry. If you do the opposite, water can run down your arm. If you need more than one napkin, by all means, get another. Just make sure that your hands are totally dry before you begin providing care. And so, everybody, that is it. That is hand washing for the CNA examination. If you liked the video, give it a thumbs up. I hope that you subscribe. And we have a whole video playlist with CNA skills and caregiver skills videos. So we hope to see you in our next video. Hey team, welcome back. It's Nurse Eunice, and in this video I'm going to show you how to put on and take off your gloves. Yes, remember, as a CNA you cannot perform sterile technique. You're not a patient care tech. You're not a hospital level CNA. So you perform clean technique only, which means that you just use the traditional gloves that will be located within your patient rooms. Just take them out of the box. You have to wash your hands first. We don't want to be contaminating these gloves, because if your hands are dirty, that means that these gloves will be dirty also. So wash your hands before and after removing your gloves. And let's get started. So I have clean hands, and now I'm going to apply my gloves. These are nitrile gloves. I want you to be mindful of any skin allergies you may have. So if you're allergic to latex, just make sure you read. And then also, my future CNAs, make sure that when you're restocking, when you're replacing the gloves, that you replace them for every person that you work with. So just don't replace the medium-sized gloves. If there's a size that's missing, be mindful and replace those too. All right, so let's get started. I'm going to put on my gloves. I have clean hands. I'm going to find the thumb of the glove. So there's the thumb. I'm going to put the first glove on. Glove is on. And let's repeat that process on the other side. I usually start by putting the glove on my dominant hand first. Is that a requirement? No, it's just something. It's a good technique, but it's not a requirement. So now that I have the gloves on, we call that donning. Now that my gloves are on, I want to show you how you should hold your hands once your gloves are contaminated. Never bring the gloves towards your body. Always keep them out and away. If there is a contaminant, if there are some fluids, it's okay for you to have them fall onto the floor, because you can always go back and clean the floor. What you can't do is have it fall onto your uniform. And so you want to stay as clean as possible, especially when you're working a 12-hour shift and you have so many patients who need you to remain clean to take care of them. So now that I have soiled or contaminated gloves, I'm going to start removing them, not at the very edge. If you try to do so at the very edge, you're going to contaminate your skin. So about an inch below the cuff of the glove, I'm going to pinch and pull off. So now this clean hand cannot touch the outside of this glove. If we do, this hand becomes contaminated. So what we're going to do instead is you can take 1 or 2 fingers. You're going to go under the glove. You're going to pull it off. And then you're going to discard of it into the appropriate waste receptacle. Why do I say that? Because if it has blood on it, it's going to go into the biohazardous waste. But if it's just regular tissue paper or something, it can go into the trash. So let me dispose of this, and I'm going to have you teach me how to perform the skills next. So go ahead and get your gloves, and we'll get started shortly. All right, team, I'm back and I have my clean gloves. Doesn't matter which glove I put on first. Should I start with my dominant hand or my non-dominant? What do you think? If you said dominant, you're right. Let's go ahead and put that glove on. Find the thumb. Glide it on. All right, so glove number 1 is on. Let's go ahead and glove the second hand. Remember, these are not sterile gloves. These are clean gloves, and you can put them on after you've washed your hands. All right, so now we're going to pretend as if the gloves are contaminated. How do I remove my glove? Do I start from up here first? Is this correct? That's right. That would be incorrect. So hands pointed downward, you're going to pinch pinch, and pull off. Contain the removed glove. Now, can I touch the outside of this glove? I cannot, but I can take 2 fingers. I can go beneath. I can remove the glove. Don't touch the inside, but you can touch the outside. And you're going to take this and you're going to put it in the appropriate waste receptacle. Now, what do you do with your hands? If you said wash your hands, you're absolutely right. Look, you all, I'm so proud of you. You've just learned how to don or put on and doff or take off your gloves. And I look forward to seeing you in the next video. Bye. Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. All right, so let's talk about how to take a pulse. And so there are different points throughout the body where you can actually feel someone's pulse or pulsation. And so every time the heart beats, contracts, blood circulates, and at different points throughout the body, you're going to be able to feel a pulse. The normal pulse or heart rate for an adult is 60 up to 100 beats per minute. If the heart rate is greater than 100 beats per minute, that is called tachycardia. If it is less than 60 beats per minute, that is bradycardia. You would notify your nurse of any abnormals or if your patient has any additional concerns. And for CNAs, the pulse that we feel will be the radial pulse. So everyone say it with me, radial. If you come up to your patient and your patient's talking to you and they're responding, do not go for their carotid pulse. Carotid pulses are for emergencies only. And so to locate the radial pulse, Mrs. Loretta, is it okay if I hold your hand?
Yes, ma'am.
And I'm going to take this call bell out the way because we won't be using it right now. The radial pulse is located in the wrist area at the base of the thumb. And whenever you're taking a pulse, I want you to remember that you shouldn't be wearing gloves unless your patient's in isolation. So for your CNA examination, of course, you wash your hands, you do your introduction, but no gloves because gloves decrease the sensation and you'll be less likely to get an accurate reading. Also, you cannot take a pulse with your thumb because if you do, you'll actually be feeling your own heart rate. You'll be feeling your own pulsations. So the way that I do it is 3 fingers. And so research has indicated you can take a pulse with 2 or 3 fingers. Both Loretta and I have worked on cardiovascular units with patients who may have irregular heartbeats, etc. So for me, I've always used 3 fingers, but you use what's best for you. 2 or 3 fingers are allowed. Think about circulation. If I raise this wrist up, this arm up, the blood flow is going to decrease. So whenever you're taking someone's pulse, keep the wrist down. Put 2 or 3 fingers on the pulse. We have a clock over here that I'll be using. At your test sites, if allowed, you can wear a watch, but usually you and your nurse will be on one side, you'll be on the other side. And so your nurse evaluator will be counting the pulse at the same time you would. And so you and your nurse, can I please get you to stay on the other side, please? Like right here on this other side? Yes. And so would you please gather her wrist? You're going to get a wrist. All right, and so we're going to be looking at the clock that's over there. All right, and so you're going to put 2 fingers here. And do you feel those pulsations?
Yes.
All right, and so I'm going to tell you when to start, okay?
Okay.
All right, so let's go ahead and start now on the 12th. We can start. All right, great job. And so at your test site, you would never know your nurse's number. The count that I received was 78. What number did you count?
78 as well.
Very good, very good. So at your test site, you can be 4 away from your nurse's reading, and you have to count the pulse for 1 full minute. So I know what they do in the real world. You'll count for 15 seconds and multiply the number by 4, or maybe 30 seconds and multiply by 2. But when you're testing to become a CNA, you want to do it for the full minute. And if you lose count, or if you feel that you have maybe the pulse isn't as strong in one wrist as it would be in the other, you can tell your nurse that, hey, I need to start over, or may I start over. You can also ask your nurse if you can switch extremities. And so don't forget to document your findings. For your state of Florida CNA exam, usually the pulse is by itself. In the real world, we can do pulse and respirations, but for the test, you'd have to do a whole introduction, take the pulse,
Document the pulse in your skill by giving the patient a call bell, making sure their bed is back low, etc. Don't forget to wash your hands if I didn't say that. And then if you have to do respirations, you have to knock on the door and start that process all over again. So I just did the pulse skill. I would make sure I tidied up everything that I documented. I wash my hands and I open that curtain at the end. I would give the patient back their call bell, ask if they have any questions, and then I would be done with this skill. I would then have to knock on the door, come back again in order to do respiration. So that's what we do for the Florida CNA examination. If it's different in your state, please let us know. Again, this is Eunice and this is
Loretta.
and we are here at Florida Training Academy. So we look forward to seeing you in the next video, which will be about respirations. All right.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
So let's talk about respirations. And so whenever you're counting a patient's respirations, you're actually letting your nurse know how well this patient's breathing. And so a normal respiration rate for an adult is 12 to 20 breaths per minute. And so a breath would be one inhalation. We're actually breathing in oxygen, and then one exhalation. So in and out. Breathe in oxygen, let out CO2. And that would be the full process. So as far as your patient's concerned, whenever a patient takes a deep breath in and then they release it, that process would be one breath. In, out, one. So if your patient's respiration rate is lower than 12, maybe you need to stimulate them, try to wake them up a little bit, but don't be afraid to notify your nurse. Get your nurse in the room, because whenever we're giving pain medications or sedatives will relax your patients, but it also causes them not to breathe as effectively. And then if a patient's anxious, maybe they're having an anxiety attack, or if they're having a lot of pain, their respirations may increase. So remember, 12 to 20 is the normal range. Anything outside of that, let your nurse be made aware. And so now we're going to focus on Mrs. Loretta's respiration rate. Whenever you take your test, don't forget you do the whole introduction first, and then after your introduction, which includes hand washing, you can tell your patient to relax. If you're having difficulty with seeing your patient's chest rise and fall and they are laying flat, you can sit them up. Opposite, if they're sitting up and you can't see the chest rise and fall or the stomach rise and fall, you can lay them flat. But play with the position as you need to in order to make sure that you get an accurate respiration rate. And then one more thing that I want to discuss is that you cannot let your patient know that you are going to be counting their respiration. So what we say instead is a blanket term. My name is Eunice. I'm your CNA today, and I'm here to take your vital signs. Is that okay?
Yes, ma'am.
So you want to keep the element of surprise, because if you tell them that you're here to count their respirations, they stop breathing on you. They're like looking at you, looking at them. So I'm going to go ahead and begin Miss Loretta's vital signs, aka respiration, shortly. All right, so Miss Loretta, is it okay if I hold your wrist?
Yes.
Right. And I'm holding her wrist to keep the element of surprise. I'm not holding her wrist because I'm actually taking the pulse. Instead, for the next 60 seconds, I'm going to look at her chest rise and fall. And I know what you do in the real world. You lie about the respiration. Stop lying. Everyone's respiration rate isn't 14. Stop documenting that. We can check the chart history and see that you're not telling the truth. So really count your patient's respirations, because again, if it's too low or it's too high, you could be the person that helps protect your patient from maybe receiving too much medications. And so now we're going to focus on the chest rise. All right, pretend that I'm still holding the wrist. For video purposes, I'm going to be counting with you. All right, and we're going to start now. 1, 2, 3, 4, 15, and 16. All right, and so now that you've actually taken the respirations, of course, you can give your patient back the call bell. Don't forget to document your findings, wash your hands, and open up the curtain if you had closed it.
Miss Jenkins, I'm here to do your pulse and respirations. I've already washed my hands and I've closed the door for privacy.
Okay.
And I'm going to begin now. Count the pulse for 1 full minute. Then watch the resident's chest rise and fall for another full minute. One exhalation and 1 inhalation equals 1 breath. Okay, done. I've finished your pulse and respirations. I'm going to go document now. You have your call bill. Anything else I can do for you?
No, thank you.
All right, thank you very much. Wash your hands and document.
So this is an illustration of the gauge on a sphygmomanometer or a blood pressure cuff. Because it's going to be harder to read on the actual cuff itself, we're going to use this drawing or this illustration over here to show you how to read the gauges so that you get your numbers accurate when you're taking someone's blood pressure. And the blood pressure is a measurement of the pressure of the blood flowing against the walls of the arteries. The arterial blood pressure is constantly changing during the course of the cardiac cycle. The highest pressure in the cycle is called the systolic blood pressure. That's the top number. The lowest is the diastolic blood pressure. That's the bottom number. Both readings are necessary to enable you to evaluate the status of your patient's blood pressure. And so in order for you to accurately obtain a blood pressure reading, you have to be able to read this gauge. If your gauge is calibrated, it's always going to start off here where it says mmHg. That's millimeters of mercury. That's how much pressure. And so we increase the pressure by actually squeezing on the bulb, and I'll show you that in a few moments. And so our machine is calibrated, is directly in the center at the bottom, which represents 0. Here we have a dark line, a long dark line, followed by 4 short lines, another long dark line, followed by 4 short lines, and then another dark line. This is how it reads. Everything's in increments of 2. You cannot get an odd number when you're taking a manual blood pressure. If you're using an automated blood pressure cuff, then sometimes an odd number will be seen. But if you're using an earpiece, a stethoscope, and a manual blood pressure cuff or a sphygmomanometer, you should not obtain odd readings. So here we go. 20. Small line above will be 22. 2 small lines above 20, 24. 26, 28. Long line with no number would be 30. Let's keep it going. 32, 34, 36, 38, 40. And so now I want you to pretend as if we are inflating the bulb. We're pumping, 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 pumping. Our patient told us that their systolic blood pressure is normally 120, so we're just going to take it 30 above to 150. Now that's the cheat way. When you're in nursing school, they may teach you a little bit differently, but I'm going to show you the quickest way possible so that you'll learn fast, and then you can add those extra techniques when you're in nursing school. So you would actually inflate the pump to 150, and then you start. Right, so we're going to pump the cuff up to 150, and then we're going to gradually release the air valve. We're going to turn it counterclockwise. We're going to turn it back towards us. And the needle should drop about 2 millimeters of mercury per second. And so where you hear the first thump is going to be called the systolic pressure. And so here it is. Let's say we heard our first thump here. You're going to continue to release the air slowly, and wherever you hear the last thump and it gets really light, that would be our diastolic pressure. You remember where you actually heard your sounds. One line below this dark line would represent 128. And then one small line above this line, if this was 60, this would have to be 70. That would make it 72. So if you were writing this blood pressure down, you chart it as the blood pressure being 128 over 72. Now let's put it all together. We know how to read the gauge. Whenever we're practicing, I always ask that you practice without an arm in the cuff until you know what you're doing. And so I know your family members want to help you, but actually just have the cuff wrapped on itself. We talked about this bulb. We have the air valve here. We're going to tighten the air valve by turning it away from us, but don't tighten it so tightly to where you can't open it with 2 fingers. So you're going to close it. You'll know when it's closed because you won't be able to turn it any further. But again, don't make it so tight until you can't open it up with your 2 fingers. I like to keep 2 fingers on the air valve at all times. But here we go. We have it closed. And now we're going to start inflating. And remember, when you're just starting off, my recommendation is that you don't use anyone's arm because you need to learn how to control this gauge. All right, so the needle's dropping a little bit. What I'm going to do is I just closed it tightly to stop it just for classroom purposes so I can show you what to do. I'm going to put 2 fingers on the air valve and I'm going to slowly move it towards me. I'm turning it very slowly and I'm letting the air release from the blood pressure cuff about 2 millimeters of mercury per second. And remember, if you are using your stethoscope, where you'd hear your first thump or your quarter cuff sound would be the systolic blood pressure. Where you hear the last quarter cuff sound would be the diastolic blood pressure. And once you hear no more sounds, you release all of the air from your blood pressure cuff. Let's practice once more. What do I need to do to my air valve? I'm going to turn it away. I'm going to close it, but not make it so tight until I can't open it with my 2 fingers. Once it's closed, you can do the 2-step method where you feel the radial pulse until it no longer, and inflate the cuff until you no longer feel any pulsations. And you can go 30 above that number, or you can just do the easy way I'm going to show you. Just inflate the cuff to about 150 if it's someone who does not have a history of hypertension. If they have a history of hypertension, you may have to go to 180 or 200. So here we go. And in nursing school, they'll teach you a different way. Right now, I'm just teaching you how to control your needle, release your air. And if you can control this needle, you can slow it down, you can speed it up. And remember, when you don't hear anything else, when you hear your last thump, you release all of the air out of the blood pressure cuff. And then you remove it, take it off of your patient's arm. So this was our practice without a patient. In the next video, I'm going to show you how to actually take a blood pressure and use a stethoscope.
Hello everybody and welcome. My name is Nurse Eunice, and in today's video I'm going to be showing you how to perform a manual blood pressure. And I have my wonderful assistant Anijah. She's going to be in a couple of our videos. So one of the first things you want to do is, of course, hand hygiene. You want to perform that first. So over here I do have hand sanitizer on our station. We also have our blood pressure cuff, which is also called a sphygmomanometer, and then we have our stethoscope. If you're going to be using your equipment for multiple patients, you want to also ensure that you have alcohol swabs so that you can be cleaning the earpieces and the diaphragm of your stethoscope before you use it on a different patient. And if you're using your blood pressure cuff on multiple patients, you want to make sure you also have wipes so that you can be cleaning your equipment and sanitizing it. We don't want you putting dirty equipment back in your care. And one thing I always like to do is to ask, is it okay if I take the blood pressure on a particular arm? So Anijah, can I use your left arm?
Yes.
Right, awesome. All right, so we're going to go ahead and we're going to place the blood pressure cuff or the sphygmomanometer
I do have another video in which I'll be showing you how to read the device. So if you've never read a blood pressure cuff before or a sphygmo manometer, just check in the description area for a separate video link. All right, so prior to placing the cuff, we actually have Enija's arm on the flat surface. And so she's sitting upright. We have her arm at the level of the heart. We're going to go ahead and bring the sleeve up. When you're applying your cuff, it has artery indicators. It has arrows on the actual cuff. And what the arrows indicate, I'm going to have your palm up for me, is this is left arm and it's pointing to the brachial artery. And so whenever you all are in nursing school and you're in your programs and you don't place your stethoscope properly, I know because number one, there's an artery indicator, which lets me know that the brachial artery is going to be on the inner aspect of the left arm. And that's also the location or the place where you be putting your stethoscope. So knowing your positions of your brachial artery, and remember, if you can see it, it's not an artery. If you can see it, it's a vein. Whenever you're doing your cuff placement, you don't want the cuff too high. You don't want it too low. This is the antecubital area. You want to make sure it's at least 2 finger breadths above the antecubital area so that you have enough room for your stethoscope. And then you're going to apply the cuff. Now, as far as your stethoscope is concerned, whenever you're placing the earpieces in your ear, you want to test your equipment. You're going to tap on the diaphragm of the stethoscope. This is the diaphragm, which is used for adults, and this is the bale that's usually used for pediatric patients. You want to tap on the diaphragm, and if it doesn't make you jump, chances are your stethoscope's not on. Some of your stethoscopes will turn. Ooh, you want to turn it until it's in the on position. And now we're going to place the diaphragm of the stethoscope on top of the brachial artery. And I'm just going to reposition this a little bit so I can see it. Make sure your tubing is not hitting the stethoscope. So I'm going to move this over. So now that we're ready to place our stethoscope, we're going to place it on top of the brachial artery, like so. When you're holding your stethoscope, try to keep your hands off of the tubing. Otherwise, you're going to have additional background sounds. So we have the brachial artery here. All right. And so this is where we're going to place the stethoscope. Whenever you are going to be inflating your stethoscope, you have to turn your valve. And remember that righty, tighty, lefty, loosey. So if you want to tighten this up, you turn it towards the patient. If you want to release the air, you turn it away from the patient. All right, we're going to inflate it to about 160. So here we go. You'll see the needle moving. Okay, so we're at 160. I'm going to turn it slowly towards me. And you'll be making note of the first hard tone or cortical sound that you hear and also the last. The first hard tone would be known as the systolic and the last would be the diastolic. And I'm just going to repeat that again so that you understand it. We've located our brachial artery. We're going to place the stethoscope on top of the brachial artery. We're going to turn this away, making it tight. I'm going to inflate the cuff to 160. You go up to as high as 200 depending on the history of your patient. If they have a history of hypertension, you go a little bit higher. You're going to slowly deflate. And note where you hear your first cortical sound and your last cortical sound. I want you to keep practicing taking the manual blood pressure. And remember that practice makes perfect. If your patient has a history of hypertension, you would start your blood pressure cuff. You would go ahead and inflate it so that the needle is about 40 above their last known reading or their highest reading. For example, if the person's last systolic blood pressure is 160, it would be okay for you to inflate the cuff to 200. If you lose count, if you're not sure, let all the air out of the sphygmomanometer or the blood pressure cuff and start the process over again. We're usually only allowed 2 opportunities to take
a blood pressure on each extremity. So if you attempt a blood pressure twice on the left arm and you're unsure of your reading, you would then have to go to the alternate arm. If you keep squeezing, if you keep applying pressure, there's going to be less circulation. It's also going to be increased pain, both of which would negatively impact the blood pressure reading. And so if you want to purchase your own blood pressure kit, I got this one off of Amazon for less than $25. If you're not a fan of the loud, bright colors, of course, they have blue, they have black, they have red, they have purple. So I'm going to have a link in the description area below.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
Hey everybody, welcome back. This is Nurse Eunice, and in this video, we're going to be showing you how to weigh a patient. And so whenever you're thinking about weighing a patient, although this may not be on your state's examination, you still have to know how to perform the skill, because some of your patients require daily weights. And that'll usually be a patient who is maybe malnourished, they're not eating enough. It could be somebody who has congestive heart failure, or they're at risk of retaining fluids. It could be somebody who's on dialysis. Well, because their kidneys aren't working, they're not excreting the excess fluids, they could retain the fluids, and that too could back up into the heart and the lungs. So whenever your nurse asks you to perform a daily weight, at least now you will know why you're doing it. Another thing I want to discuss before we start the skill is to make sure that you do your weights first thing in the morning before your patient has eaten, and also make sure they use the bathroom. If you have a balance beam scale, you'll have to go ahead and zero it. We have an electronic scale, and that's what we're going to be using today during our demonstration. And we're going to get started now. With every skill, you're going to knock on the door before entering the room, and then you're going to greet the resident. Hello, Mr. Mitchell. My name is Eunice. I'm your CNA today, and I'm here to weigh you. Is that okay?
Yes, ma'am.
All right, before I begin, let me go wash my hands. I'll be right back. Don't forget to wash your hands. For the CNA exam, you'll be washing your hands before and after the skill, and also provide privacy. So what have I done so far? I've knocked, I've introduced myself, I've greeted the resident, I've explained the procedure, I've gotten their permission, and then I've washed my hands, and I've also provided privacy by closing the curtain. And now let's get our patient up. Let's get them sitting upright. Right. And so, are you able to sit up? Can I assist you?
Yes.
Right. All right. Now let's bring your legs over, okay? Right. And before we stand you up, let's get you to scoot just a little bit. I want to make sure your feet are flat on the floor. And before we get you up, how do you feel?
Fine.
All right. No dizziness?
No, ma'am.
All right. And even though I didn't say it before, Mr. Mitchell has non-skid socks on. And so if your resident or your patient did not have the non-skid socks, you would then put their shoes on. But this is going to be best for the weighing skill because it doesn't add as much weight. All right, so on the count of three, we're going to stand, okay? 1, 2, and 3. You're still feeling okay?
Yes, ma'am.
And so we have an electronic scale here. I'm going to help you on the scale, and then we're just going to put my arms around you once you're on the scale, just in case you lose your balance, okay? All right, let's go ahead and get you to step on. Thank you so much, Mr. Mitchell. Let's get you to step off, please. All right, so if I can get you, you can either step back or you can turn towards the bed. Okay, great job. Do you need help getting your legs back in the bed?
No, ma'am.
Okay, all right. And here's your call bill, Mr. Mitchell. Is there anything else I can help you with?
No, thank you.
All right, I'll see you in a few moments, okay?
Thank you.
So now that we've finished the scale, I want you to pick up your scale. If your facility requires that you clean it off, by all means do so. But don't forget to document. That's right. But I want you all to document for me. In the United States, we document in pounds. However, if your facility requires that you document in kilograms, you'll do so by dividing the number of pounds by 2.2. So whatever the number of pounds were divided by 2.2, and that would give you the weight in kilograms. But you must document after you perform the weight. Don't forget to go wash your hands, open up that curtain, and then just to look back. Make sure that the bed is in the lowest position, that your patient or resident has their call bell.
One last thing I want to add. In the state of Florida, if you're taking a CNA examination, the side rails are optional. So if the side rails are there, you're welcome to raise the rails. However, if they were lowered when you came in, you can also perform the skill and keep them lowered. The goal is for you to be able to provide care and provide care safely. So you're not passed nor failed on the absence or presence of the side rails. You are judged on how you provide the care and whether you can do so safely. So I hope you learned a lot from this video. Remember, we have to do those weights. It helps to monitor the health of our patients. And I'll see you in the next video.
Hello, I'm Nurse and the owner of Florida Training Academy. In today's video, I'm going to be showing you how to brush the teeth of someone who is in the bed. I have all of my supplies here, which will include a towel that we'll use as a clothing protector. I have the toothpaste and toothbrush. Of course, I have clean hands with gloves on them. I have the emesis basin, a cup of water, and I'm going to go ahead and start the skill. You want to be mindful of safety. And so in order to prevent our patient from aspirating, what position do we need to put our patient in before we put water in his or her mouth? And if you said upright 90 degrees, that's perfectly correct. The Fowler's position can go from 60 degrees all the way up to 90. I just feel more comfortable raising my patient up as far as they can tolerate. So I'm going to go ahead and raise our patient. Are you doing okay today? If you feel like you need to reposition, you can go ahead and do so. I'm going to put a towel over your chest. Would you like a sip of water before we start?
No, thank you.
I'm going to wet the bristles of the brush. Apply a small amount of toothpaste. And this one is mint. Are you okay with mint?
Mm-hmm.
And now we're going to perform the skill. Okay. And with my clean gloves, I'm going to go ahead and open up your mouth. All right. We're going to start off with the front teeth. Going to go inside. I'm going to repeat that process up top. And now that I've brushed all, and if you go ahead and cinch your or clench your teeth together for me. All right, so now that I've brushed all the surfaces, if you'll stick out your tongue, I'm going to brush your tongue. I'm going to now give you some water so that you can gargle. Good, and we'll let you rinse one more time, and I'll make sure I clean your beard. Very good. Clean your mouth and your beard. So now that I'm done with the brushing of the teeth, I'm going to throw away my disposable supplies. After emptying the contents of my emesis basin into the toilet, I would have to use a napkin in order to turn the water on because my gloved hands cannot contaminate the sink or the faucet handles. So I would rinse, pour out my rinse water, and then I would dry the inside of the emesis basin. Of course, I would store whatever supplies I have left. Don't forget to take off your gloves, wash your hands, reposition your patient, put that side rail back up, and make sure that he has his call bell in his hand before you leave. And then also remove the protective covering. All right, everybody, this is Eunice for Florida Training Academy. We wish you the best of luck with your future CNA examination, and we hope that this skill will help you to pass your test and also provide better care for your residents.
Hello everybody and welcome back. This is Nurse Eunice with Florida Training Academy, and in this video we're going to be showing you how to clean dentures. We know that dentures are extremely expensive, and so you want to make sure your dentures are in a case. For the state of Florida exam, don't forget that denture care is a two-part skill. After cleaning the dentures using the denture brush and the denture paste, which don't have toothpaste, you have to go back and provide mouth care. And when you're providing mouth care, you're pretending like your partner does not have any teeth. Remember, it's just a test. Even if someone did have real dentures, they're not going to take them out just so you can pass your test. So since you're pretending that your patient doesn't have any teeth, instead of using a toothbrush to cleanse their mouth, you're going to use that toothset or swab. And I will make sure that I have an image so that you can actually see what that looks like if you've never seen one before. But let's focus on first things first. Let's focus on denture care. All right, so I'm going to go ahead and open up the cap and place my dentures on the countertop. I'm going to put a washcloth in the base of the sink. We know that when dentures come out of someone's mouth, they're really slippery. And so we don't want them to hit the porcelain, the inside of the sink, and be damaged. I'm also going to start running some cold water. We only want to use cool or cold running water on our dentures. We don't want the water too hot because real dentures could be affected or reshaped by the hot temperatures. I'm going to go ahead and wet the bristles of my denture brush. At the test site, they may have you using toothpaste, but in the real world, we use denture paste on dentures because toothpaste would cause abrasions that would allow germs to grow on the denture and cause the dentures to have an odor. So test site, you use what they have. Real world, use denture paste on dentures. I'm going to rinse off the dentures. Remember, for this scenario, the person just removed the dentures from their mouth and they're preparing for bed. I'm going to brush all surfaces of the dentures. This angular portion, let's say there was some adhesive or something in the denture, I can remove that, or some food particles. I can use the angled portion for that. Make sure you hold the denture securely, and when you're done, there should be paste all over your denture. You can now rinse. Make sure you also rinse your denture. When you store the dentures in a cup, especially if you have the upper and the lowers, think about the orientation, how they go in the mouth, and that's how you want to put them in the cup too. So since these are the upper dentures, we're going to put them in the cup with the teeth down and the gums up. And now, so the dentures don't dry out, I'm going to put water into the cup so that the dentures are actually beneath the water. That's going to make sure the dentures are comfortable for your patient. At the test site, your nurse might tell you to pour the water out. Do whatever he or she tells you to do. I can now turn off the water. Remove my washcloth. I'm going to go ahead and take this washcloth to the laundry basket. I can now take my denture supplies back into the clinical room, open up the cabinet and store them. And don't forget, denture care is a two-part skill. After performing denture care, you have to perform the resident's mouth care. All right, everybody, again, this is Nurse Eunice with Florida Training Academy. I hope you liked our videos. Go ahead and like and subscribe. Share our videos with a friend. And if you know anybody who's interested in being a CNA or a nurse, this is a great place to start. Plus, you get to do so for free. All right, everybody, have a blessed day. Bye. In this video, I'm going to be showing you how to feed a resident. And don't forget that, monitoring your patient's fluid and food intake is so important. It helps to prevent malnourishment. It also helps to prevent dehydration. And so at the end of the skill, don't forget to document. And of course, as with every skill, I've already washed my hands. I've provided privacy. I've provided privacy. I've put on gloves. I've explained the procedure to our patients. And now I'm going to get our patient in the safest position for someone who's going to be fed. I'm going to get him upright to a high Fowler's position. Is it okay if I change your position now? And Patrick is a wonderful patient actor. If anyone in Florida is looking to hire this wonderful actor, I will make sure that I have the contact information for you. And of course, right now, yes, he's giving Jesus vibes. I know it. All right, so now that I have my supplies on my table, I'm going to go ahead and put a towel on his chest in order to protect his clothing. For the Florida Certified Nurse Assistant Examination, you always want to offer the person an opportunity to wash their hands before feeding. And the reason why you want to make sure the resident's hands are clean is because in real life, your patient may either reach up and touch you, or they're going to try to assist and touch their food and they're going to contaminate it. So Patrick, half of the washcloth is wet, the other half is dry. Would you go ahead and cleanse your hands for me? And then flip, and you can dry your hands with the other half. You would now take this and put it in the laundry basket. During the Florida CNA examination, you will have 2 different food choices. Patrick, is it okay if we feed you applesauce today? And the song or mnemonic that I made here at Florida Training Academy is hands, water, 3 bites, water, wipe. Go ahead and repeat that with me. Hands, water, 3 bites, water, and then wipe. If you can do those 5 steps, you're going to pass the CNA examination. So I've already washed Patrick's hands. Now I'm going to give him water in order to wet his mouth. The way I like to think about it is if you are giving a patient something to eat. Let's say it's a biscuit and they're just waking up. They have a biscuit with their breakfast tray and they're on oxygen, or if they're on a medication that can dry the mouth. If you just give them a biscuit without giving them water first, it's going to make it really hard for them to swallow. So we're going to help Patrick by giving him water before we give him food. Everything went down okay? Now we're going to feed our resident using a spoon. However, we're not going to overfill the spoon. We're only going to put half of the applesauce. We're only going to put half a spoonful of applesauce on the spoon, and we have strawberry applesauce, which is your favorite. Okay, can you open up for me? Very good. We're going to repeat that 2 more times. Awesome. And then this is the last bite that we have to provide for the state of Florida CNA examination. Good. All right, so let's go back to our song. Hands, water, how many bites? 3 bites, making sure you check the mouth after each bite. And we want to make sure that the food really gets down. So we're going to provide water next. Here's some more water. Okay, everything went down okay? For the state of Florida exam, you cannot leave anything wet. So we just gave our resident water. We want to make sure we dry his mouth and his beard. We're almost done. Hands, water, 3 bites, water, wipe. I want you to think about a person who's depressed, especially depression in the elderly. If an elderly person does not want to live, how would they help to ensure that they are not with us much longer? I don't want to say how would they commit suicide, but the way that a person would die in your nursing home is by refusing to eat. And so after you feed someone their 3 bites of food, you want to ask them if they want more. Of course, in the real world, you feed them as much of the food as they want. My rule of thumb is if my patients don't eat 50% or more of 2 meals, I want you to go ahead and notify that nurse, because we can contact the doctor, we can get supplements ordered, we can help that person get the nourishment that they need. Even if they may not want to eat it, we can use other mechanical devices to ensure that they're getting the nutrients. So hands, water, 3 bites, water, wipe. Would you like more to eat? Would you try another bite for me? Just one more bite? Okay, very good. Here we go. Did it go down okay? And here's some more water to wash it down. I'm so proud of you, Mr. Patrick. Wipe your mouth. I'm going to remove this, okay? You're also going to place your clothing protector in the laundry basket.
Mr. Patrick, I know you normally like to lay back, but I have to give your food time to digest. So for about 30 minutes, I will lower you a little, but I can't lower you flat until your food has digested. Are you okay with that? Take off your gloves. Dispose of your gloves in a trash can. Make sure that you lower the bed. If you raise it to a working height, raise the side rail back up. Leave your resident with a call bell. Don't forget to document. For the state of Florida examination, food intake is documented in percentages in increments of 25. And so he didn't eat none, he didn't eat zero, and he definitely didn't eat 50%. We document 25%. All right, everybody, this again is Nurse Eunice with Florida Training Academy. We hope that you're able to feed someone safely. Don't forget that after you feed them, don't lay them all the way down immediately. Give that food time to digest. So about 30 to 45 minutes later, you can come back and lay your patient down. You know our closing techniques. Open up the curtain, wash your hands, document, check on your patient, make sure they have the call bell. Bye, everybody.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
Come in. Hi, good morning. Good morning. My name is Eunice. I'm your CNA today, and I'm here to do your hand and nail care. Is that okay? Yes, ma'am. All right, before I begin, let me go wash my hands. Okay. Hands are clean. Closing the curtain. And may I take this? Thank you so much. Can you raise your feet for me? Bring them over the rail. Perfect. And you can lower them. All right, may I hold your hand? I just want you to test the water temperature. Is that okay? Yes, ma'am. Very good. So let's test the water temperature one more time. Still okay? Yes. I'm just going to move this over just a little bit. Okay. And for those who are viewing in preparation for the CNA exam, you only have to clean one hand. So we have clean water that does not have any soap inside the basin. I'm going to go ahead and keep my washcloth folded. I'm going to fold it once more. I'm going to wring it out over your hand. How does that feel? Good. And we're only going to apply 1 drop of soap. Still feeling okay? Yes, ma'am. Rotate your hand. Put this to the side. I'm going to rinse your hand now. All right, so this is an orange wood stick I have to clean beneath your nails. Okay. So I'm going to clean and wipe. Clean and wipe. Am I hurting you? No. Perfect. Going to bring your hand down. Support it. Because your nails are already manicured, I just need to make sure they're not jagged. I'm just going to foul just a little bit. Okay. Still doing okay? Yes. I'm going to apply lotion. And I need to remove the excess lotion, okay? You still feel okay? Yes, ma'am. Can you raise your feet for me? Okay, so now that I've taken all the items away, here's your call bill. Is there anything else that I can get for you right now?
No, ma'am.
Okay, I'll come back and check on you during my next rounds, okay?
Okay.
All right, I'm opening up the curtain. I'm going to go wash my hands and document if I have to do so. Everybody, this is Nurse Eunice with Florida Training Academy. This was our demonstration on how to provide hand care for the state of Florida exam. You can watch our videos on YouTube and also on my personal channel, which is nurseeunice.com. We'll see you in the next video. Bye-bye.
All right, so this is our foot care skill, and we have the wonderful Tanisha here who's helping us for the state of Florida examination. You only have to perform foot care on one foot. We have a towel on the floor because the barefoot cannot touch the floor. We also have an additional towel that we'll use for drying. We have washcloths. We have a basin of water that is comfortable. We've already had Tanisha check the water temperature. We also have soap and lotion. Notice that we do not have any toe utensils. We're not trying to clip toenails, and we're also not going to foul toenails. That is not a CNA duty in the state of Florida. All right, so before I begin foot care, I'm going to go ahead and put on some gloves. And we have you check the water temperature with your hands. However, now I want you to check it with your foot also. Can I get you to check the water temperature with your foot? Is it still okay? Yes. We'll move this over just a little bit. All right, we're going to begin the washing process. We're going to wet it, wring it out. Apply 1 drop of soap. I'm going to bring your foot out just a little. Thank you so much. And we're going to begin the washing process. I'm going to wash the top. I'm going to go in between each toe. I'm also going to clean the bottom of your foot. How does that feel?
It feels good.
Okay. Let's go ahead and rinse. And this is a really easy skill. Pretty much I wash the foot, I rinse the foot, and I dry the foot. So I'm going to support your foot. I'm going to bring it out. Great job. I'm going to move this over. I'm going to put this on the floor. And I'm going to pat your foot dry. I also have to make sure that I dry between the toes. And you're still doing okay?
Yes, ma'am.
Now, as far as lotion is concerned, I'm going to warm it up first. And then I'm going to apply that to your foot also. Let's raise this up. Let's give it a little bit extra to that heel, okay? Great job. And for the Florida exam, even though we normally let this absorb, I have to remove the moisture right away. And just as a reminder, we do not put lotion between the toes. Let me take this away. Great job. So now I have to assist you and put your shoe and your sock back on. So let me support your foot. Thank you so much. And there's your shoe. And I'll take all this away. Correction. The towel touched my leg. All right, so once you've completed foot care, you want to clean all your items. Of course, you're going to rinse and dry your basin, store everything where you received it from, put up your dirty linens, your dirty washcloths and towels, and then you have to take off your gloves. The proper way to take off your glove is that you'll pinch from the palm, pull down, contain the removed glove into the dirty glove, and then you go under, remove the second glove. Take this to the trash can, wash your hands, and you know how we end every skill. We make sure our hands are clean, that the curtain's open, that our resident has the call bell, and that if we have to document, we do so for the skill. This is Nurse Eunice with Florida Training Academy and nurseeunice.com. We'll see you in the next video.
All right, so this is Eunice with Florida Training Academy and nurseeunice.com. And in this video, we're going to be performing the transfer from the bed to the wheelchair skill. As we begin every skill, we always want to knock and introduce ourselves. Don't forget to wash those hands, provide privacy, and remove the call bell.
So let's prepare our wheelchair. Before we put a patient inside of a wheelchair, we first want to lock the brakes. The pedals or the footrest should be up. And then there's usually a lever on the inside of your wheelchair that once you engage it or pull it, it should allow the leg of the wheelchair to go back. So when you're putting a patient in the wheelchair, there shouldn't be anything for your patient to step over. Let's do this again for classroom purposes. All right, so I just pulled my wheelchair to the patient's bedside. What's the first thing I do to ensure safety? If you said lock the brakes, you're absolutely correct. Let's lock the brakes. You don't want your patient stepping over anything because they can fall. So we're going to raise the pedals and then move the legs out of the way. And this is how you prepare your wheelchair for a patient to be transferred from the bed to the wheelchair. Knock, knock, knock. Come in. Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to put you in a wheelchair. Is that okay? Yes. All right, before I begin, let me go wash my hands. Okay. All right. And so don't forget to wash your hands. Hands are clean. We're going to provide privacy by closing the curtain. And I'm just going to remove this because we don't need it right now. How are you feeling today? Feeling good. I'm going to prepare my wheelchair first. So I'm going to lock the brakes as we showed you in another video. I'm going to bring the pedals up, bring the leg of the wheelchair back, and repeat the process on the opposite side. Okay, I'm going to gather your legs and bring you over. Okay, can you scoot over a little bit for me? It'll be a little bit easier. Perfect. And 1, 2, 3. Let's go ahead and get you over to the side. All right, we have to make sure that your feet are on the floor, so I'm going to try to lower the bed a little. And this is as low as the bed goes. So let me get you some shoes on. And then I'm going to make sure that your feet are touching the floor. Can you touch the floor for me? Great job. We're going to apply the gait belt, and this just helps me transfer you safely. Okay. Okay, doing a 2-finger check, making sure the only 2 fingers fit inside of the belt. Are you feeling any discomfort? Yeah. Okay, so our feet are on the floor. Just going to bring this wheelchair a little closer. I'm going to part your legs just a little. Okay, so now your arms go on my shoulders. And on the count of 3, I'm going to stand you, turn you, and sit you into the chair, okay? Okay. 1, 2, up on 3. Turn and sit. Great job. How do you feel? I feel good. And so now, I'm going to put 2 feet on 1 pedal. And I don't have to lock the wheelchair. The wheelchair still moves side to side, even though the brakes are locked. If you don't feel comfortable doing that, or if your patient's heavy, you can unlock the brakes, but do place the lock back. Because for the state of Florida CNA exam, your patient's not going anywhere. They're just going to be in the wheelchair for a little bit. Okay. So here's your call bell. Is there anything that I can get you right now? No, ma'am. Okay, there you go. Okay. I'm opening your curtain. Washing my hands, and you are done with your skill. We'll see you in the next video. This is Nurse Eunice with Florida Training Academy. Bye.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.
Hello, everybody, and welcome back. My name is Eunice. I'm a registered nurse and the owner of Florida Training Academy. In today's video, I'm going to show you how to perform range of motion exercises to our patient's upper extremity and also lower extremity. Performing range of motion exercises is extremely important. Not only does it loosen stiff joints, it also helps to prevent atrophy or muscle wasting. Remember, if your patients don't use it, they lose it. So you want to encourage them to use their muscles, to move things, to actually comb their own hair and participate in their care. Additionally, something else that you may not consider is that whenever you have a person move around, it improves their circulation and they're less likely to develop blood clots. All right, so we have our wonderful patient actor here. His name is Patrick, and we're going to go ahead and begin. I've already washed my hands, provided privacy. For this skill, I will not be wearing gloves. Let's go ahead and start. All right, so I'm going to start off by exercising your shoulder. Do I have your permission to do so?
Yes.
All right, so let's go ahead and straighten out your arm. If during this process you feel any pain, just let me know. All right, so I'm going to bring your arm all the way up as far as you can tolerate. Very good. 1, 2, and 3. Very good. I'm now going to bring it out towards me. 1, 2, and 3. And next we're going to do rotations, okay? I'm going to bring it out, and I'm just going to 1, 2, 3. Great job. Did you feel any pain?
No.
All right, so I'm just going to fix your shirt just a little bit. And so now we're going to exercise your elbow. I'm going to take my supporting hand, go beneath your elbow, and we're going to do 3 curls. 1, 2, and 3. Still doing okay?
Mm-hmm.
All right, I'm going to exercise your wrist. I'm just going to gently support. I'm going to have my hand on your palm, and we're going to go down 3 times. 1, 2, 3. And for camera purposes, I'm not hyper extending, bringing the arm back or the wrist back too far. I'm just going down in a natural position 3 times. And then next, we're going to go side to side 3 times. Last will be our rotations. 1, 2, 3. So let's repeat that. Down and up 3 times, side to side 3 times, rotation 3 times. For the state of Florida examination, you do not have to exercise fingers. However, if you know that one of your residents has arthritic fingers, that could be something you can talk to the physical therapist about or the physical therapist assistant so they can show you how to relieve those stiff joints. Now we're going to go down to the lower body. So Patrick, now I'm going to exercise your leg. Right? I'm going to go under the calf and support and also under the mid thigh. And we're going to go up 3 times. Let me know if you feel any pain. 1, 2, 3. I'm now going to bring your leg towards me, the same as we did with your shoulder. 1, 2, 3. And now we're going to do our hip rotations. 1, 2, and 3. Everything okay? I'm going to exercise your knee. I'm going to put my supporting hand beneath your knee. And I'm also going to take my other hand and go under your heel. And that's going to prevent your heel from dragging. I'm going to go up 3 times. 1, 2, and 3. Still doing okay? Now we're going to exercise your ankle. Let me support your heel so it doesn't drag. All right, we're going to go down 3 times. 1, 2, 3. We're going to go side to side the same way we did with your wrist. 1, 2, 3. And now we're going to do those rotations. 1, 2, and 3. So is it okay if I lay you down some?
Yes.
So we're going to lower the head of the bed. But we're also going to bring the bed up to a working height. Lower the side rail. Can I get you to come closer to me, please? Can I get you to turn away? You're welcome to grab onto that rail. Thank you. Try to keep your resident covered as much as possible during the skill. And now I'm going to roll this bottom fitted sheet in. And then I'm going to push, 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 and push. If the mattress was sold, you would raise the side rail, then go get you a washcloth, a towel. You can cleanse the mattress and dry the mattress. And another technique I like to use is I would push a dry towel under the patient. That way, there's no way that my new linens could be contaminated by the old linens. And so if you need a demonstration on that, just let me know, put in the comments, and I'll make that video. But for your state of Florida examination, there will be nothing on the mattress, so you can just proceed. Let's recap. So far, what I've done is I have safely gotten my patient onto their side. I have rolled in the dirty bottom sheet, and I maintained privacy throughout. Now I'm going to start applying our fitted sheet. Check on your resident to see if they're okay. Mr. Mitchell, how are you doing?
I'm doing good. Thank you for
Good.
asking.
And then work your way up towards the top of the bed, making sure that the corner of the fitted sheet aligns with the corners of the mattress. And then tuck whatever material you need to tuck under the mattress. I like to roll my fitted bottom sheet. Clean and your dirty sheet, they can meet, but they should not overlap. So I have no wrinkles. All right, Mr. Mitchell, I'm going to lay you back. You still doing okay?
Yes, I am.
Can you center yourself in the bed for me?
Yes.
Okay, so what I like to do now is I call this demummifying my patient. I don't want to get him wrapped in these sheets. So what I'm going to do is I'm going to just release the top sheet at the foot. And I'm going to bring this fold of the sheet over. So now I have a clear view of my dirty linens. And I'm going to ask my patient to come towards me. And if you come towards me, and so you'll stay on your back, just bring your whole body towards me and now turn away. 1, 2, and 3. Great. Make sure you keep your resident covered as much as possible. Fortunately, our patient has on pants, so their bottom isn't exposed. But if that's not the case, if your resident has on a gown with no underwear, with no pants beneath, just make sure you pull that top cover over a little bit more. So now we have to remove the dirty fitted sheet. I'm going to lower the side rail. When we're removing our dirty linens, we don't bring anything towards our uniform. We roll it away from us. So watch me. I'm going to roll it in and then roll it away. Every few minutes, just check on your resident. Mr. Mitchell, are you still doing okay?
I'm good. Thank you.
And of course, this is going to go in our laundry basket. So now we have to pull down. We have to pull this fitted sheet so that it fits the mattress. And then don't forget, we can't leave any wrinkles. So let's do it together, team. We're going to pull taut. And we're going to lift the mattress and tuck. Pull taut and tuck. And keep doing that all the way. Pull taut and tuck. Pull taut and tuck. This is what it should look like. Your patient should not be laying on wrinkles because wrinkles cause bed sores. All right, let's get our patient back onto his back. Oh, Mr. Mitchell, you're doing such a great job. Let's get you on your back. Let me get some of those wrinkles out your gown, and you can center yourself in the bed. Okay. For this next part, you don't need to lay flat. Okay, I'm going to raise you up just a little bit. You still doing okay? Good. Now that we have our patient centered in the bed, what I've done is I have raised this top dirty sheet. I don't want to totally expose him yet. As I'm preparing the new top sheet, what I'm going to make sure of is that we have a clean area to unfold. So watch as I unfold now. And I've already set Mr. Mitchell up. If you think about the elderly population, a lot of them do not like to lay flat for long. So you had them flat while you were changing the flat fitted sheet, but you can set them up a little bit because the hardest part of this skill is now done. So I like to allocate some of the top sheet over the footrest because this will allow me to tuck the top sheet and to make my miter corner. Now, before I go any further, I just want to make sure that it is even on the side. So this skill requires that you do a lot of backwards and forward, but it's going to be worth it because your patient's going to have clean linens, and that's going to help them sleep better. Okay, and so now that my top sheet is halfway in position, what I like to do now is I like to make a tent. Imagine there are some visitors in the room or a family member who wouldn't leave. I'm going to hold the clean top sheet up with one hand and then remove the dirty sheet. Once the genitals are covered, once their private area is covered, I go ahead and then I take two hands and I remove this top sheet that was dirty. Don't bring it towards your patient's face. Bring it away and put it in the laundry basket. If your gloves are obviously contaminated, of course you could change them. But remember, for your test, we're going from semi-clean sheets or clean sheets to more clean sheets. So thank you so much for your patience. I'm sorry it's taking longer than anticipated. We're just making sure we're training future healthcare professionals. All right, so let's prepare for our miter corners, or you can also call this your hospital corner. I'm going to lift one half of the mattress and tuck. Repeat that process on the other side. Lift half of the mattress and tuck. Now that we have the top sheet tucked at the foot, repeat these words with me. Up, tuck, down. I'm going to undo that. So, top sheet is tucked at the foot. I want you to bring the first layer up at an angle, make a V, tuck the part of the sheet that's nearest the mattress, and now bring it back down. That is how you'll get your mitered corner. Up, tuck, down. I'm going to repeat that process on the opposite side. Up, tuck, down. As a reminder for the Prometric CNA examination, you do not tuck the top sheet along the sides. If you do so, that would be considered a restraint. So you only tuck at the foot of the bed, but then to make sure that your patient or your resident has room to wiggle his or her toes, just make a little tent and nice little wiggle their toes, wiggle, wiggle, wiggle. And if they can wiggle their toes, we also know they have enough room to move their heels, and that way they're going to be less at risk of getting a pressure sore. And so we had 3 linens that we needed to change. So far, we've changed the bottom sheet and the top sheet. Don't forget to change the pillowcase, you all. That's one of the easiest ways to not be successful on your CNA exam. So top sheet, bottom sheet, pillowcase. Let's get that done now. Mr. Mitchell, can I get you to raise your head for me? Thank you so much. As long as you don't shake the pillow out of this case, you're doing a good job. I need for you to keep being patient. Remember, if you get this skill, you will more than likely have upwards of 40 minutes to complete your test. So don't rush. You can do it. All right, I'm going to simply grasp the pillow, and then with just pulling, I'm going to remove the case. I'm not going to shake. And this goes where, everybody? On the floor? You're right, laundry basket, which I have right here. In most of your test sites, you can either put the pillow towards the foot of the patient's bed, or you can put it on the bedside table. Do whatever you feel is best. For video purposes, I'm going to put it on the foot of the bed. Now I'm going to prepare my pillowcase. What I like to do is you can scrunch, but the end goal would be for you to be able to see the internal seam of the pillowcase. So once you can see the internal seam of the pillowcase, I like to go seam of the pillowcase to seam of the pillow with the tack side inside of the pillowcase. So let's go seam to seam. You all follow me. Seam to seam. Lift the pillow and pull down. How easy was that? I didn't shake and I did not put my arm all the way in the pillow. So seam to seam. I want you to practice it at home. And now, even though it's not a requirement, we usually tuck. I call it making an envelope. And so the way I'm going to do this is I'm just going to lay it down so you can see it better. I'm going to tuck one end of the pillowcase in onto itself, then tuck the next end. So this is what it's going to look like. Okay. Mr. Mitchell, can you raise your head? All right, yes, sir. You can lay back now. Let's take off these gloves. Do you remember how to do so? Yes, that's right. We're going to pinch about 1 inch beneath the cuff. We're going to pinch and pull off. And now how do I take off the second glove? I'm going to take 2 fingers. I'm going to go under, remove, and then pull off. I'm going to discard of this in the appropriate waste receptacle. So once my gloves are off, I need to go wash my hands, but I have to make sure my patient is safe first. So I want you to tell me, what do I do now? You are so right. That's right. I have to lower this bed down to its lowest position because right now it's up at a working height. This would present a fall hazard. So let's lower the bed down. Great. Now, do I just wash my hands and leave? Or am I forgetting to give my patient something important? Yes, I need to give him his cold light. All right, Mr. Mitchell, here's your cold light, okay? Just call me if you need anything. Do you want your glasses back?
Yes, please.
Yes. All right, here you go.
Thank you.
You're so welcome. Gonna put your bedside table here. When I come back in the room, I'll bring you some water, okay?
Thank you.
You're welcome. And as we do with every skill at the end, our patient has a cold light. They are comfortable. I'm going to go wash my hands. I'm going to open up that privacy curtain and don't forget to document. And so everybody, this is Nurse Eunice with Florida Training Academy. Yes, I have a workbook that's out that covers all of these skills. You can get that book by going to booksbyeunice.com or just looking for the link in the description area. And I'll see you in the next video. All right, Mr. Mitchell, I'll see you during our next rounds. All right, so Patrick, I'm going to be changing your position. Okay? And your doctor wants you on your left side. If I can get you to come towards me just a little, that's going to ensure that I don't have you too close to the other edge of the bed. And now if you can use that handrail, I'm going to help you turn. And we're going to get you to your left. And so I'm going to bring your hips back just a little. Great job. Straighten out your clothing. Are you still doing okay, Patrick?
Mm-hmm.
This first pillow I'm going to put behind you. I'm going to lean you just a little bit. It's going to be uncomfortable for a few moments. I promise you it'll feel better. All right, so now that I have this pillow rolled and tucked against your back, if I can get you to come back just a little bit, and you can release the rail. Now, Patrick, I'm going to bend your knees, okay? I'm going to be parting your legs to put a pillow between them. Sorry if my hands are cold. Now I'm making sure, I just want to go back and recheck everything to make sure your knees are not touching and that your toes and your ankles are not touching. I'm going to take this arm, bring it back. Want to make sure you're not laying on this arm too much. Very good. I'm going to bring you a pillow to hug. You still doing okay?
Mm-hmm.
All right, so for our fourth and final pillow, can I please ask you to raise your head just a little? I'm going to make sure this pillow is cradling your neck and supporting your head. How does that feel? All right, so Patrick, I'm going to give you this call bell, okay? All right. And so if you need anything, please call me. For the state of Florida CNA exam, of course, you'll pull back up the covers. You would not overexpose your resident. The students that are CNA exam prep course here at Florida Training Academy will actually go through all of these skills. Just make sure your pillows are properly placed and that you are protecting the bony prominences such as the inner knees, the ankles, and the toes from touching each other in order to prevent a bed sore. In the real world, you'll change your patient's position at least once every 2 hours or more often if your patient experiences pain. At the conclusion of your skill, lower the bed all the way down. If you lowered a rail, make sure you bring it back up. Don't forget to wash your hands and open up that privacy curtain. I hope that this helped. If you have any questions, our website is fltraining.com, and we look forward to training you and seeing you in our next video. Bye-bye.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
Come in. Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take you for a walk. Is that okay?
Yes, sir.
All right, before we begin, let me go wash my hands. I'll be right back. Hands are clean. Yeah, I think your call bell. How have you been doing so far? Okay. So this is a gait belt, and we're going to use this to walk you. Are you having any problems, any weakness today?
No, ma'am.
Okay. So if I can get you to pull your legs back just a little bit for me and raise your arms. I'm going to put this gait belt around you. Thank you so much. You're welcome to lower your arms now. Just want to get your hair out the way. I have to make this a little snug. I'm putting 2 fingers in. Okay, and our feet are on the floor. Great job. On the count of 3, I'm going to lift you a little, okay? 1, 2, 3, let's stand. Great job. Are you dizzy?
No.
All right, we're going to take 10 steps. Let's go. 1, 2, 3, 4, 5, 6. All right, we're going to say that's 10 because of the limitations of our room. And now we're going to turn back towards the chair. And before I walk you any further, are you dizzy?
No, ma'am.
All right, let's take our 10 steps back. Great job. Okay, let's turn. I want the back of your legs touching the chair. All right, and so we don't have a chair with armrest, but the bed has an armrest over there. So if you'll feel for the side rail, and on the count of 3, we're going to sit. 1, 2, and 3. Great job. How do you feel? Okay, I'm going to remove this gait belt. Okay, I don't want to tear your skin. I'm just going to remove this carefully. Here's your call bell. Is there anything else that I can get for you right now?
No.
Okay, I'll be back on my next rounds, okay? It's up. Want to open up the curtain. Wash my hands. Before you say that you're done, make sure you've done everything that's required for the state of Florida CNA examination, such as making sure your hands are clean, that your patient has the call bell, that if you provided privacy, that you open the curtain back up, and at the test, if your nurse requires you to document, make sure that you also document the skill. This is Nurse Eunice, everybody. We'll see you in the next video. In today's video, we're going to be showing you how to dress a resident who has a weak arm. And to me, the skill is a little bit unfair if you have the skill on your certified nursing assistant examination. And the reason why I think it's unfair is because you're supposed to be dressing a person who has a weak right arm. However, you're dressing a mannequin who, you know, if you think about it, would be more like dressing a quadriplegic in traditional clothing. If we had a quadriplegic, we usually have more adaptive clothing that had snaps and or Velcro.
Regardless, we're going to perform this skill. We're going to pass our test. You all know how we always begin. We've washed our hands. We've knocked on the door, washed our hands. I'm going to go ahead and put on some gloves. I've provided privacy. And of course, I've explained the procedure to the patient. In this particular instance, because it could involve nudity, this skill will be played on a medical mannequin. And the nurse at the test site, the evaluator, will answer on behalf of the mannequin. All right, so I've asked the resident which garments would they like to put on. I gave them a choice of 2 tops, and she said that she wanted to wear this top. So now that our resident has chosen which shirt she'd like to wear, I'm actually going to conserve some of my strength. I like to start off with dressing the bottom half of the mannequin first. So I've done my introduction, washed my hands, I'm applying gloves. Privacy's been maintained because I pulled the curtain. I'm not overexposing the resident. I'm exposing exactly what needs to be exposed. She still has her gown on. I've uncovered her feet because I'm going to start off with placing the socks. I'm going to open up the socks, open up the opening, stretch it out a little bit. Don't pinch on their toes because they could have gout, which is a painful, like an inflammation of the toes. I'm going to spread the sock just to make sure, smooth it out, just to make sure that there's no wrinkles. Remember, we don't leave wrinkles in our residents' clothing or in their gowns because those wrinkles could cause an irritation or an indentation that could later lead to skin breakdown, aka a pressure sore. All right, Miss Lucas, you're still doing okay? Great. We're going to start next with your pants. I'm not going to overexpose. What I'm looking for is the tag within the pants so I know which way to place the pants. And so the tag goes towards the back. I'm going to gather up one leg of the pants without putting my hand or my arm all the way through it. If you do something like this, you're contaminating yourself. So you don't want to do that. Instead, just gather it up from the outside. And now repeat the process on the opposite side. Remember that for our video purposes, I don't walk around to the other side of the bed as much as I would in the real world. So at the test site, if you're not able to get the leg, the resident's leg into the pants from one side of the bed, feel free to walk over to the other side. Okay? So now that I've done that, my next task is to bring those pants up without overexposing the resident. So I'd like to find the waistline. And as I shimmy the pants up, I also bring the gown up. Okay. And it's a lot easier to do this if your patient is flat. Anytime we're repositioning a patient, you want the head of the bed to be in the supine or the flat position. All right, and so my pants are now placed. Just want to make sure it's covering up her bottom. I'm going to raise you just a little bit, okay? Great. I'm now going to walk around the other half of the bed in order to remove the sleeve from the left arm. Whenever you're undressing, you undress with the strong arm first. Undress the strong first, but dress the weak first. I'm going to raise you up just a little bit. Going to untie your gown. Thank you so much. And yes, the gown has snaps, and this would be something similar to an intravenous line. However, for your state of Florida examination, your patients will not have IVs, so you don't necessarily have to have a snap gown. I cannot guarantee whether the gown will have snaps or not, which is why I'm teaching you how to remove a gown the traditional way. So I've now undressed the strong arm. And if you feel comfortable, if you feel like lowering the rail, you can. Sometimes I work around the rail. It's what's, safest for your patient, of course, but also your comfort level. And right now I'm comfortable working with the rail there. As with the pants, I'm not going to stick my arm into the sleeve. I'm going to gather the sleeve like hosiery. Gather it, gather it, gather it. I'm going to make sure I open it up.
I'm going to support the hand as I bring the sleeve up. Let me know if you feel any pain. And I'm going to allocate the front half of the jacket. At the test site, there'll be a nurse. You can ask her for turning help, but I'm used to maneuvering patients, so I'm going to turn her by myself. I'm going to go ahead and cross your legs. I'm just going to turn you a little bit. I'm going to support this arm. So I'm going to go under the arm, get the hip and the shoulder, and on the count of 3, we're just going to turn a little bit, okay? 1, 2, 3, and let's turn. Make sure that you bring the gown forth. Make sure those pants are on well, and our pants are on. And now I'm going to push this through, making sure that I get out as many wrinkles as possible. And I can always finish the de-wrinkling process, that's what I'm going to call it, when I get through to the other side. Remember, with this arm, you have to support it. This is the weak arm. So if you do this, they're going to count you off. They're going to mark you off. So you want to make sure that you actually support that arm. I'm going to reposition you some, okay? I'm going to cross this leg. Walk back around. So this is one of those skills where if you get this during your exam, you're pretty much given more time. And so for a standard floor examination, you're given 31 up to 41 minutes to complete your 3 skills, which include hand washing and gloves. But if you get this skill, chances are you're going to be the one who will receive close to 41 minutes to complete their test. So now I just have to simply move my patient, turn her, bring the jacket out, and now dress the strong arm. The weak arm is dressed. I'm going to move you over towards me some, okay? To make sure my patient does not roll too far, I bend the leg nearest me, bend that knee, turn her. On the count of 3, we're going to turn, okay? 1, 2, 3. I'm going to bring this jacket out. Correction if I overexpose. This tends to be the hard part, believe it or not, because remember, it's supposedly the mannequin has a weak right arm, but it's a mannequin, so all of the extremities are weak and they're stiff. So it's really hard for me to get this jacket onto the arm without me overextending the arm. So I'm going to go ahead and apologize if I bend your arm too much. In the real world, we would not be using this type of a jacket on a patient who was a quadriplegic. So this again is one of the reasons why I think this skill is not the best skill. It's not realistic. I'm going to straighten out the wrinkles, make sure they're all removed. Turn my patient back towards me, reposition her. Correction for not supporting that hand. You all heard it hit. I don't want to get marked off. Before I can remove that gown, I'm going to have to fasten all of the snaps and or buttons. I can now take this to the laundry basket. Always leave your patients nice and neat. The pants are a little bit bigger than I would have liked, but we have totally dressed our mannequin. There, so I can get rid of some of those extra wrinkles. Compliment your patient on how well he or she looks. So don't forget to give your resident the call bell to hold. Make sure you open the curtains so that they're not left claustrophobic, Wash your hands. If you have not lowered the bed, make sure you do so. And if you have taken down or lowered the side rail before you ever leave your resident, make sure you pull the side rail back up. One more thing I want to state, that for the state of Florida examination, whether the rails are there or not, that does not pass nor fail you, because your state of Florida examination is geared toward all adult populations, and people who are in the home care, they may not have medical beds. They can have traditional beds. So as long as you can turn someone safely, and you can do so without them falling off the bed or getting too close to the edge, whether a rail is there or not, you should be good. All right, if you have any questions, you can find us at fltraining.com. And if you want to take a CNA exam prep course or a CNA trainer course right here in Florida, you know how to find us. Have a great day and goodbye. In today's video, we're going to be showing you how to perform the skills that are needed in order for you to pass the Prometric CNA examination. I'm based out of Florida, so if I'm showing you something that is different than what your instructor or your school has taught you, then of course I need you to go by your formal instruction. And then also, disclaimer, the training that we're providing here today does not substitute a accredited CNA program. It's to help those who are ready to take their test, just review their skills. And also we have playlists with multiple practice questions. If you're in Jacksonville, Florida, and you actually want to come to our facility to learn the hands-on skills, we have the CNA exam prep courses, which are 2 days, and they are great for pre-med, pre-nursing students. It lets you get in, focus on your skills, and the majority of our students pass on their first attempt. All right, so let's get started. The skill that we're going to be showing you right now is going to be perineal care. And perineal or perineal care can be performed on both men and women. However, for the state of Florida examination, the skill is performed on a woman only. And we're going to begin with our normal procedures. We've provided privacy. We've washed our hands. And now we're going to don gloves, which means put on gloves. And of course, we've already told the patient about the procedure and what we were going to do. So let us begin. All right, so I'm applying gloves to my clean hands, and I have my supplies. I have my table here that has towels, washcloths, a bed pad, a bath basin with warm water, and then also soap. For the state of Florida exam, we begin by actually changing the bed pad that's beneath the resident. You would not do this in the real world. You're only doing this for the state of Florida CNA examination. I have the rail down on the side nearest me. I'm going to remove this call bell because I don't need it. I'm right here with the patient. Whenever you're maneuvering someone who cannot turn themselves, it's a good ideal to move their body incrementally. And then I'm also preparing the pad in advance. So I'm going to roll it halfway in. So I have everything I need. Now I'm going to move my patient towards me for safety. Shoulders, hips, and then legs. I am going to expose her a little bit more than what I normally would, but remember the curtain's already pulled and that I'm doing this for classroom or for teaching purposes. And now I'm going to turn my resident. The easiest way to turn a resident is by bending or crossing the leg nearest you and then going and using the large joints, the hips and the shoulders, and the hip and the shoulder, and turn away from you. Just going to reposition my patient to make sure she's okay. Are you okay? I'm going to roll this pad in. I'm going to apply a new pad. All right, making sure the pad starts off at the upper hip level. Push it through. Trying to make sure there's no wrinkles in it. And now I'm going to lay my resident back down. Only for the state of Florida examination would you change the pad before you actually cleanse the resident, but that is what's required for you to pass the test. And our goal is for you to pass the test and not overthink the process. If you are tall enough, you can just simply unroll, take out the dirty, put it in the laundry basket. Excuse me, the dirty, put it in the trash can. Roll out the rest of your pad. And then recenter your patient. I'm going to expose you a little and let me cover up your legs for warmth. All right, so whenever you're cleaning a woman, you want to clean the outer folds of the labia, the opposite fold of the labia, and then go down the center. Because we're only cleaning a mannequin, technically it's already clean. So we're only going to do 3 wipes. But in the real world, you would wipe until your resident was 100% clean. So if you're at the test site, you want to have your nurse test the water temperature. If your water had gotten cold because it took you a while to change the pad, you may want to put this rail back up, cover your patient, and then go get fresh water. When you're preparing your washcloth, fold it into an 1/8. So when I pick it up, it's already folded, so it's folded into a 1/4. Pick it up and, fold it once more. And then every time you wipe, you just peel a layer, and peel a layer. Every time you wipe a woman, you're supposed to use a different spot on the washcloth. So it'll make sense in a few moments. I'm going to wet my washcloth, wring it out very well. I don't want to have to change my new pad that I just placed. So I'm going to be drying my gloved hands on the towel that's on top of the table. For the state of Florida examination, we do not put soap directly in the basin. We apply 1 drop of soap to our washcloth, and I'm going to wipe the outer lip going down. Change positions, even though it's no soap on that part of the washcloth, because I put the 1 drop of soap, it counts for the entire washcloth. Don't overthink the process, just pass the test. And then I'm going to wipe down the center. So I cleanse by going down, front to back. I did one side, outer. I repeat the process on this side, outer, and then I'll wipe the center. And now I'm going to rinse the same exact way. Are you still doing okay? I'm almost done. All right, so this is our rinsing cloth. I'm going to dry my hands so that my pads do not get wet. I'm going to find the corner that I'm going to be pulling down. And how do I wipe? You're correct. Outer, center. Always wiping down. Whenever you get your new towel, don't let it touch you. And I'm going to dry the same exact way. I'm drying you now. Outer, center. I'm going to reuse this towel for her rectum and her buttocks. I can now cover up the front of my resident. Okay, I'm going to have to turn you in order to clean the back of you, okay? We're going to turn. Remember what we did last time? You came towards me. I'm going to uncover your legs so it don't get caught. Make sure your arm's out. Across your leg. All right, now I'm going to turn you on the count of 3. 1, 2, 3. Get you repositioned. Get you off your arm. I'm going to cover her for warmth. Try to make sure your legs are not touching the bed. And now whenever I clean the resident, I'm going to still continue wiping from front to back, from cleanest towards the dirty area. We're going to get another washcloth. So now I'm on my 3rd washcloth. I'm going to wet it, wring it, dry off my hands. And remember, for the state of Florida examination, how much soap do we apply on our washcloth? If you said 1 pump, you are correct. I'm going to wipe towards the back. I just wipe the rectal area. I'm going to change spots on the washcloth. I'm going to wipe this buttock up, lift the washcloth, wipe the other buttock. Of course, if this was a human, every time we wipe, we'd see residue. So we would know if we were using the same spot twice. So again, for your CNA exam, don't overthink it. Just remember to check your water temperature to make sure you don't wet that pad, to keep wiping in the correct direction, and to wipe all the areas that you're supposed to wipe for perineal care. You also have to communicate with the resident, and the nurse will answer on behalf of the resident. So far I've washed, I just rinsed, and now I'm going to dry
And for the buttocks, you can use the back or the palm of your hand. I tend to use the back of my hand only because I've worked in psych, and some of those patients can say some strange things to you. And so if you're in a facility, they may have butt paste or different types of ointments that you could apply to your resident, but for the state of Florida examination, that is not a requirement. Make sure there's no wrinkles behind your patient. That even includes the gown. Okay, I'm going to lay you back now. We always want to keep our residents aligned. So you're going to reposition him or her back, reposition her back into the bed, straighten out her gown, remove any wrinkles. Take off your gloves. I can then let this rail back up, clean my supplies, re-glove if I need to do any other procedures in the room. And then don't forget that before you leave, make sure the patient has the call bell, rails up, curtains open, wash your hands, and you're done with your skill. All right, so this has been Eunice Mathis, practicing perineal care. I hope this helps you. If you like our videos, go ahead and like this actual video, subscribe to our channel, and if you pass your test and our videos helped you, please leave a comment and let us know. We appreciate you and we wish you the best. Bye-bye.
Hello and welcome back. This is Nurse Eunice with Florida Training Academy, and in today's video, I'm going to be showing you how to perform perineal care on a male resident. Let's talk about our supplies. Some of your facilities will require barrier cream. We have our body wash. We have washcloths. I think I have 4. We have 2 towels in addition to a towel that's on the table. I prefer to put a towel on the table. That's not a requirement, but because this is this patient's eating surface, I want to keep it as clean as possible. So that's the purpose of the towel. I have a laundry bag. I also have a laundry basket, which you can't see. It's off camera. Some of your facilities will allow you to use wipes, others will not. So if you're able to use wipes, go ahead and do so. And then if I need to change the pad, I have an additional one. So this is a disposable pad. You may refer to it as a chucks, but beneath the patient right now is a reusable, it's a washable pad. So we'll see if it needs to be changed. And so whenever you're thinking about perineal care, you're always thinking about preventing cross-contamination. So we want to start from the cleanest area and then work our way to the dirtiest area. So it's going to be front to back. Other things you need to be mindful of are body mechanics, so making sure that your bed is up to a working height, which it is, and try not to work over rails. I've already gotten the patient's permission. I've raised the bed. I've washed my hands. I've gloved up. I've allowed him to check the water temperature. If, because of limitations with movement, he was unable to put his finger into the water and check the temperature, I would simply wet a washcloth and then drop some of the water from the washcloth onto his hand, and that would be a way that he can check the water temperature. One more thing that I want to encourage you to do is to encourage independence. So allow your patients to do as much as possible, even if it's not perfect. And so if they can move their extremities, allow them to maybe wash the penis, and then you would take care of the scrotum and the rectum. So here we go. Let us begin. Introduction's already been done. I'm just going to move this over a little bit. Mr. Lucas, how are you doing? Good. I'm going to lay you back. Is that okay? Yeah. And I know you heard me tell our audience that we were doing perineal care, but you may not know what that means. So perineal care is pretty much me cleaning your genitals, your private area. All right. Are you still comfortable? Good. And I like to communicate with my patients and let them know what I'm doing. All right. I'm pulling your cover down. You do not want to overexpose. Something that I prefer to do is to actually put a towel. So if you have a bath towel, that's wonderful. But if you have a towel, you can put that over their genitals. Let's say somebody walks in quickly and they didn't knock. The purpose of this towel is so that I could easily cover my patients. Sometimes family members, they're not medical professionals, so they're just going to do what they want to do, and they're going to come in fast, and I want to make sure that my patient is protected. So are you still doing okay? All right, great. I'm going to open up your legs a little bit just so I can see. All right, so I'm doing my skin assessment at the same time. I'm looking at his penis. I'm looking for any drainage, also checking for discoloration, any different smells that may be abnormal. Whenever you are preparing your washcloth, you're going to, here's a washcloth that's open. Fold it. Now it's halved. Fold it again. And now it's in quarters. And what I do is once I wet it, wring it, and apply my soap, every time I use a different area on the washcloth, I peel a corner back because we should not be using the same corners or the same spots on the washcloth twice. In addition to that, once you've used the washcloth, I forgot about my other item, my laundry bag. Once you've used the cloth, it should not go back into your water because we don't want to recontaminate my water. So we have that right there. Mr. Lucas, I'm going to go ahead and start, okay? Wet it. Wring it. Remember to keep it folded. I'm going to open up my soap. Right. Let me know if you feel any discomfort. I'm going to take the soapy part of my washcloth. I'm going to clean in a circular motion without using the same spot twice. So here we go. Starting at the meatus or the tip of the penis. Go around. And let's peel back. I know a lot of you all are saying, well, Eunice, you only had soap on one spot of washcloth. If you do put too much soap on your patient, that can cause dryness. And if I was, really concerned, I would just put soap on the next washcloth. So far, what I've washed or cleansed is the shaft of his penis. I've not washed his skin folds. I've also not washed his scrotum or his testicle area. You still doing okay? Good. I'm gonna put some soap on. Make sure that now I'm going to complete that process. And if I get close to the rectal area, I pull back, get a new corner, get close to the rectal area, pull back, get a new corner. And now let me clean his testicles. Don't forget that as men age, their testicles are not nice and firm. They usually start hanging. And so you want to make sure you lift those testicles up because it could be some bacteria, some fecal matter that's beneath. And that's going to cause your male patients to be touching themselves because they're actually itchy. After I wash, I now have to rinse. You still doing okay? Good. All right, so we're going to rinse the same way we wash. We're going to start here at the tip. Try not to touch the bed. I'm going to go around the shaft. We have to remove that excess soap off. Going to go down and change. I flipped it, down and change. Get a new area. Rinse the testicles. And now I'm drying. Make sure you dry thoroughly. Don't leave any area wet because that would be an area where bacteria can grow or yeast can grow. Remember that yeast like areas that are dark and moist. And so I'm going to fold this because I'm going to reuse this towel because I used it after he was clean. And so are you still doing okay? Great. Let's pull back your covers. All right. So that was the front part of the bath. Now I need to actually clean his rectum area. All right, let's get you to come closer. If my gloves were obviously contaminated, I will go ahead and change them out now. But so far, we're okay. If this was a patient who could move, I ask him to move himself toward me. Before you have a patient turn away from you, make sure that opposite rail is still up. So here we go. I'm going to help you come towards me. I'm going to get your shoulders first. Then I'm going to get your legs. We're going to go this way, okay? You have any pain right now? All right, we're going to turn 1, 2, and 3. All right, you're kind of creaky. Good. If you can hold on to the rail for me. Perfect. Let's not overexpose. Okay, so the towel that I previously had on his front, I'm going to use it to just put beneath him. That way, if any moisture drips, I won't have to change the pad because right now the pad is clean and dry. And make sure it's also wrinkle free. All right, so now that we have him on his side, we're checking on him to make sure he's okay. And so far, we're doing really good. Also, if you have your vital sign monitor, you can be looking at the heart rate, looking at the pulse ox, looking at the O2 saturation. That will help be an indicator also. I did a really good job cleaning from the front because I can see that there is, his testicle area. There is no stool or anything. But now that I have him on his side, I want to go from the cleanest area towards the dirtiest area. And if I need to re-clean those testicles, I could. All right, so we're going to go ahead and clean the rectum area. And so if we had to clean that area multiple times, we'd peel back and then clean again. For a mannequin, that's all he needs for his rectum area because he's not truly contaminated. For a patient, you would use as many washcloths or wipes as you need in order to make sure that their rectal area is clean. So after I clean the rectum, I clean the buttocks. We're going to go up. I'm going to switch back. Clean another area of the buttocks. So now buttocks are clean. Clean area on the washcloth. Clean up. And because I couldn't clean the entire buttock with that one stroke, I'm just going to pull back again and clean again. So make sure that whenever you're doing this, you have sufficient washcloths. I'd rather you bring too many washcloths in the room than not enough. Mr. Lucas, are you still doing okay? Great. I'm almost done. I'm going to rinse you now. And you all should be pros at this by now. So we rinse the same way that we washed. So we're going to go from crack to the back, change positions, rinse the buttock, complete rinsing that buttock, especially if they have a larger or a wider bottom area. Repeat that process here and repeat it again. We don't leave anybody wet. So we're going to dry. I'm going to pat his buttocks. This is a good time to do a skin assessment. So his skin folds, his skin was not impaired. Everything was intact. If your facility required you to put on ointment, you would put that ointment on now, usually on the coccyx area. Sometimes, especially if they have excoriation, similar to like a baby rash, you would put that on, but you'd only do so if your facility or your nurse told you to do. So make sure you follow those policies. I'm going to wipe that off because this is just a mannequin. All right, make sure there's no wrinkles in your pad. Mr. Lucas, I'm going to help you lay back now. Going to discard of my gloves. Going to wash my hands or sanitize my hands. And now I can finish getting him repositioned. We like to leave our patients in the center of the bed. So the way that I move somebody who's unable to move themselves is I move their body in increments. So you do not want to pull a joint because you can dislocate that joint. So I'm going to support both shoulders. I'm going under and I'm moving him over. Reposition his pillow. Make sure his hips are aligned. Check his feet. This will be a good time to elevate the feet if needed. And because most patients do not enjoy laying flat, I'm sure you don't either, I'm going to make sure that I raise the head of his bed back to his tolerance. And if you cannot reach over the bed without touching the linens, you would need to walk around. So I'll walk around and finish the other side. But before I leave, I need to raise the side rail. All right, let me know when you're up high enough. That's good. All right, here's your call bell. Team, great job. So we have provided perineal care to Mr. Lucas. And so now you'd have to, of course, reglove because you have to clean these supplies. And so you'd be emptying your
water basin. Once you rinse it, and you can clean it with soap if that's what your facility requires. And we usually dry it. We don't want it air drying. So you're going to dry it out, and then you're going to take your laundry away. Right now we have a laundry basket. We can put everything there. Our bed is a safety issue because we raised our bed up to a working height. We need to lower that before we leave the patient. Don't forget to leave him with the call bell. See if he has any other needs before you exit the room. My side rails are up. Clean up your room, and don't forget to document. If there is something that you found that was concerning, you notify the nurse, and then in your documentation, you'd also put, what that concern was and that the nurse was notified. So I hope you learned a lot. All right. And so I look forward to seeing you in the next video.
So I've done the normal procedures. I've washed my hands. I'm donning gloves. I've provided privacy. I've explained the procedure to the patient. I've assembled my items and also gotten the bed in the position that I want it in. Remember, with the catheter, you always want it flowing independently and freely towards the foot, lower than the bladder. In the real world, or maybe some type of securing device on the upper thigh, you may or may not have that during the Florida CNA examination. Okay? All right, so we've checked the water temperature. And now I want you to repeat after me. Wash, wash, rinse, rinse, dry, dry. Wash, wash, rinse, rinse, dry, dry. I folded my washcloth. I wrung it well. Make sure the nurse has already checked my water temperature. And if you remember from our previous videos, we fold our washcloths into a quarter and we peel back each time we wash. For the state of Florida examination, your water must always remain clean. You apply soap directly to a wet washcloth. Let's begin the washing process. Outer, outer, center. Wipe down and change. I'm going to move your leg a little. Wipe down and change. I'm going to wipe above the catheter. I'm going to change spots. I'm going to raise the catheter gently without tugging. I'm going to wipe the center beneath the catheter. Wash, wash. You cannot wash, rinse, and dry the vagina with a dirty catheter. So it's going to be wash the vagina, followed by wash the catheter. Remember, whenever we're cleaning the catheter, we don't want to tug. That's going to cause pain to our patient. So we're going to pinch at the insertion point. I'm going to start cleaning your catheter now. Talk to your patient as you perform the skills. I'm going to take this washcloth that has 1 drop of soap. I'm going to wrap it around, and I'm going to go down about 3 to 4 inches. I'm going to change positions. I'm going to repeat that process for a total of 3 times. I'm trying to get as close as I can without tugging. That was wash, wash. What's the next steps? We're going to have to rinse and rinse. So we're going to get a new washcloth, going to wring it out. And now we're going to rinse the same way that we washed. Down, change, down, change, above the catheter, change, gently lift the catheter, wipe down the center. Now, whenever you are rinsing your catheter, even though you had to wash it 3 times, you only have to rinse it once. Before I start rinsing, what do I have to do? If you said secure the catheter, you're absolutely correct. So I'm going to secure the catheter. I'm going to pinch it, and I'm going to rinse down about 3 to 4 inches. Awesome. We can't leave our residents wet. So once we have washed and rinsed both the vagina and the catheter, we're now going to dry. We're going to go down, go down, go down. If you notice, I'm always changing positions. Go down. And now whenever I dry, I'm going to pinch, pull down gently. For the state of Florida examination, you would have placed a pad before catheter care, and at the end of your skill, you have to remove the pad. In the real world, usually there's always pads beneath your patients. However, for the test, don't forget, catheter care, place the pad, and then remove it at the end. If you need to see how to place a pad, just go back to our perineal care video, and it will show you how to do so. All right, everybody, it's Nurse Eunice with Florida Training Academy. If you like this video, go ahead and give us a thumbs up.
share it with a friend. Don't forget to subscribe to our channel. And if you're here in Jacksonville, Florida, or if you're in the Florida area, we provide hands-on CNA exam prep classes in 2 days, which are perfect for pre-med and pre-nursing students. All right, everybody, have a great day. Bye.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.
In today's video, I'm going to be showing you how to put a resident on a bedpan. And for one of our demonstrations, Patrick is going to be able to assist by raising his hip. And the second demonstration, he's going to act as if he's unable to move. And then I'll show you how to put the bedpan under someone who needs more assistance. For your Florida CNA examination, it doesn't matter which technique you use. I usually advise our CNA students to use the easier technique because our pretend patients, when they're taking their CNA examination, should have the ability to raise and lower their hips. If I don't say it in each video, don't forget, I've already washed my hands, I've closed my curtain, and I've already gloved up. If I do not change my gloves for every step, do realize that this is a training video. If you want to support us by sending us super thanks, that will allow us to provide more gloves and buy more gloves so that we can actually change gloves more frequently during our skills. We know that in the real world, you change your gloves and you would not be recontaminating other items. This will suffice for the Florida CNA exam. All right, no more disclaimers. Let's go ahead and get started. Patrick's sitting up. I cannot put anything beneath someone if they're sitting on their bottom, so I'm going to lay him down. You doing okay today, Patrick? I'm going to remove this call bell. I'm going to raise up the corner of your sheets here. For the state of Florida examination, there will not be a pad beneath the resident. So you're going to prepare your pad. Remember that the plastic side will go towards the bed, just like a diaper if you're thinking about a baby. And the cotton side will go towards the skin. I'm going to roll this in halfway. Remember, for our first skill, Patrick's going to be able to assist. All right, so Patrick, on the count of 3, can I get you to bend your knees? Number 1, bend your knees. And then on the count of 3, if you can raise your hips up as far as you can. All right, 1, 2, 3, let's go. Very good. And you can lower. So now the pad is placed, and remember, I did not overexpose my resident. I can now go to the cabinet and retrieve the bedpan. When you retrieve the bedpan, you also want to bring the toilet paper. For this skill, the patient would be able to wipe him or herself. Remember, in the real world, this would be something that the CNA would be doing if the patient was unable to assist. Don't overthink this. It's just for the test. All right. Here's the toilet paper for you to use after you get through urinating. Whenever you're placing the bedpan, you want to place it based upon the form and the shape of the bedpan. For a male, they sometimes have smaller bedpans, and then they also have urinals. But for the CNA examination, I want you to pretend that all of your residents are females. And because it wouldn't make sense to put this under Patrick if he was just simply urinating. We give him a urinal instead. But for your test, pretend that all of your partners are female and that you're putting a bedpan beneath them to collect their urine. All right, and so now from the side, on the count of 3, when I ask you to raise, please do so. 1, 2, 3, raise your hips. Very good, sir. All right, you can lower your knees now. In the real world, you'd actually look between your resident's legs, make sure that you can actually see the bedpan, because if not, you can actually get more urine on your bed and complicate your skills. You'd actually have to then give the person a bath and change the bed linen. Now that I've given Patrick the toilet paper and the call bell, I want to raise the head of the bed so that he can really clear out his bowels or his bladder. For the state of Florida examination, you're putting somebody on the bedpan who's pretending to urinate. So this is not a skill in which you have to wipe them. It's just practice. All All right, and you're not going to take off your gloves for the floor to CNA examination. You're going to go behind the curtain for about 5 seconds. And whenever you're done, you'll come back and ask your resident if they have finished using the restroom. All right, Patrick, are you finished? All right, thank you so much. I'm going to take the call bell. If I can get you to keep holding on to the toilet paper until I have a place to store it. You're now going to lower the head of the bed. All right, Patrick, on the count of 3, can I get you to raise up for me? 1, 2, 3. Thank you so much. You can lower your knees. All right, so for the state of Florida examination, you'd of course put your disposable pad inside of the trash. For the state of Florida examination, you go into the bathroom. You then empty your imaginary contents into the commode. In order to rinse the bedpan, you cannot touch the faucet with your gloved hands. So you're going to use a napkin to turn on the water. Get your rinse water into your bedpan and then pour the rinse water into the toilet. Turn off the water using a napkin. Now you're left with a wet bedpan. You'd have to then get a napkin to dry it out. And then whenever you're storing your bedpan, you cannot contaminate the cabinets. You will take a napkin to open the cabinet. Store the bedpan. May I have the toilet paper? Store the toilet paper. Your gloved hand cannot touch the cabinet. You would use that same napkin to close the cabinet. You can now take off your gloves and wash your hands. However, there is one more step left to this skill. You have to ask the resident whether or not he wants to wash his or her hands. And I'm not an advocate of toting a used towelette with my bare hands. So in the real world, you can take off your gloves, wash your hands, put on new gloves. But for the state of Florida examination, you can go through the whole skill with one pair of gloves on. Remember, you're only simulating putting someone on top of a bedpan. They don't want you wasting supplies. All right, Patrick, half of the washcloth is wet, half of it is dry. Would you go ahead and cleanse your hands and then dry your hands with the other half? Thank you so much. Put the used washcloth inside of the laundry basket. Take off your gloves. Fix the bedding. Give your resident the call bell to hold. Would you like your head of the bed raised any? Reposition your patient for comfort. Lower the frame of the bed, wash your hands, and don't forget to open those privacy curtains. All right, everybody, this is Eunice Mathis with Florida Training Academy. Stay for a few more moments so we can show you how to put somebody on the bedpan who's unable to assist with the skill. So now I'm going to demonstrate how to put a resident on the bedpan who's unable to move. I do have the resident exposed for video purposes only. Of course, in the real world, you would not overexpose your resident. This video will not be showing the cleaning technique. It is literally showing you how to put someone who cannot move on a bedpan and then removing the bedpan. For our classroom purposes, the resident already has a pad beneath them. For your Florida CNA examination, you'd be responsible for placing the pad. One last reminder, you do not have to use this particular technique in order to put a patient on the bedpan when you're taking your CNA examination. You can use the easier technique, which is your resident raising his or her hips, you placing a pad in the bedpan, and then removing the items in the same technique or the same skill set. Now we're going to begin. I've lowered the head of the bed. We have our pad, and now I'm going to go to the cabinet and retrieve my items. All right, so I've lowered the head of the bed. We're going to go ahead and get started. I need to put our patient in a safe position. If I have him or her turn too much right now, they'd be too close to the edge of the bed. So I'm going to move him in increments and get him closer towards me. I'm going to use your shoulders. We're going to come up and towards me. Very good. I'm going to do the same with your hips and your legs. I'm going to cross the leg nearest me. I'm actually going to bend the knee, cross it over, And so now when I turn the resident, this knee is going to help him remain on his side. And something else I can do is just extend the forearm so that he doesn't roll on it. If your bed has rails, you can also ask the resident to hold onto the rail. On the count of 3, I'm going to turn you, okay? 1, 2, 3. Very good. Smooth out any wrinkles. Your resident should not have wrinkles beneath them. And remember, he's exposed for video purposes only. You will not overexpose your resident in the real world. I'm going to use the napkins, open my cabinet. I'm retrieving toilet paper and also the bedpan. For this particular skill, since the resident can't help, I'm not going to give him or her the toilet paper. However, I do have it near me so that I can use it whenever we're done with the skill. Whenever you're placing your bedpan, find the larger collection area that usually goes towards the thigh. The very top of the bedpan goes at the top of the hip. I want to push this under just a little bit. Make sure it's centered. On the count of 3, come back towards me. 1, 2, 3. Get your hips on it. Okay. Are you okay? I'll get you recentered in bed once we take the bedpan out. I'm going to raise the head of the bed to make going to the bathroom easier. It's bad. Before you leave your resident's bedside, make sure you give them the call bell. Of course, put the sheets back up. But for video purposes, we're just going to lay the resident right back down and take out that bedpan. All right, Patrick, I'm going to cross your leg. I'm going to secure this bedpan, and on the count of 3, I'm going to help you turn, okay? 1, 2, 3, turn. Notice how I held this bedpan down. Had I not, it could have tilted, and I could have gotten some of the moisture, the wetness, whether it would have been urine or fecal matter, on my resident. You would finish the cleaning process. All right, let's go ahead and take it back. Remember, we're not going to overexpose our resident. He doesn't have to be perfectly neat right now. I can always come back and finish the process once I've finished emptying the bedpan. I'm going to empty the imaginary contents into the toilet. I'm going to use a napkin to turn on the water faucet. I'm going to rinse the bedpan. I'm going to pour the contents into the toilet. I am now going to cut off the water. I can use a different napkin in order to dry out the bedpan. And don't forget that for the state of Florida CNA examination, you have to use a napkin if you have your gloves on whenever you're storing your items. Make sure you also offer to wipe the resident before the CNA exam. As long as you give them toilet paper, the person will pretend to wipe themselves. All right, so now I'm going to recenter my patient back into the bed. Pretend that I have taken off my gloves, washed my hands, and applied new gloves. I'm now going to reposition my patient in bed. All right, so now I'm going to get you back centered, okay? If you can release the rail. All right, I'm going to bring you over. 1, 2, 3. Going to do the same for your hips. 1, 2, 3. And your legs. Let's get these legs in line also. Sorry if I scratched you. That wasn't my intent. Are you still doing okay?
Mm-hmm.
Want to get that wrinkle out the bedding. You walk around. Hey, Patrick, here's your call bill. Is there anything else I can do for you right now? Make sure you take off your gloves. Wash your hands. If you lowered the side rail, you would have raised it before you left your patient's bedside. If you brought the bed up to a working height, don't forget to lower it. Open up your privacy curtains, scan your room, making sure that everything has been cleaned and that the patient's right to comfort, safety, and privacy have been maintained. And if everything is done, you did a great job. All right, everybody, this is Eunice Mathis with Florida Training Academy. We look forward to seeing you in our next CNA training video. Bye-bye. Hi, good morning, Miss Netta. Hi, Miss Netta. My name is Eunice. I am your CNA today, and I'm here to give you a bath. Is that okay? Before I begin, I'm going to go wash my hands. I'll be right back. Hands are clean. Closing the privacy curtain. Miss Netta, I'm going to take your call bell, okay? How are you feeling? Well, I hope you get cleaned up soon enough so that you can return to watching TV. Because I have to wash your face, can I remove your glasses? And I'll give them right back to you after the bath is done. I'm lowering you. Let me know if you feel any discomfort. Still doing okay? Alright. I'm not going to lay you totally flat because I know you were complaining of back pain earlier. Let me know if anything starts to hurt you. Is the temperature of the room okay? Good. I'm going to remove your sheet. And I already have the curtain closed. I'm going to put a bath blanket on top of you. This will keep you a little bit warmer during our bath. And for those of you all who are taking the CNA exam, if you do not have a bath blanket, you can use a towel. This provides warmth and it also helps to dry your resident. Okay. Raise your head just a little. I'm going to raise you just a little so that I can go ahead and remove your gown. Place this in the laundry basket.
So for the state of Florida CNA examination, you would have your nurse check the water temperature. She will act as the resident. In the real world, whenever you are putting water in your basin, if you already have your gloves on, you would allow some water to either run onto your wrist, or you can do a taste here and the water feels fine. All right, so Miss Netta, I need to put a towel on top of your pillow. 1, 2, 3, let's raise up. I'm also going to put a towel under the arm that I'll be cleaning. And for the state of Florida examination, a partial bed bath, you only clean half of the mannequin's body. It's usually the upper half. That means you only have to clean one arm. We're going to clean the face, the chest, the stomach, the arm, turn our resident, and then clean her back. Okay. Wet it. Do not apply any soap to the face. Keep your water basin clean. Don't reuse washcloths. So I'm going to clean your eye, starting from the inner area, wiping towards the out. Change spots. Repeat that process, inner to outer. Change spots. And now I'm going to clean the rest of your face. How does that feel, Miss Netta? Good. Put this in my laundry basket. I'm going to use this towel here to dry you. Inner, reach over. Inner to outer. Going to pat dry the rest of your face. You're still doing okay? For my second washcloth, I will apply 1 drop of soap. 1 drop of soap is all that is required for the Florida CNA examination. As a reminder, soap dries out the skin. So 1 drop of soap is all you'll use. I'm going to start here cleaning your neck. I am going to raise the bath towel to provide privacy. But for classroom purposes, so that you all can see what I'm doing, I'm going to pull the bath towel down. Okay, so I start at the neck, long strokes down. I'm going to go ahead and clean the other half of the chest also. If she had pendulous or breast that sagged, I would lift the breast tissue and make sure that I clean beneath the breast also. I'm going to clean her abdominal area. Remember, just 1 drop of soap. I'm going to cover you back up now. Remember, I only exposed her for classroom purposes or for teaching purposes so that you all could see what I was doing beneath the towel. Cleaning her hand, cleaning the back of her arm, and the last part of the body that I'm going to clean is going to be her armpit. So a partial bed bath for the state of Florida exam is just the upper half of the resident. Now I'm going to rinse the same way that I washed. I'm going to rinse you now. Try to be mindful. Do not allow your uniform to touch the bedding. Correction for overexposing. You still doing okay? Notice every time I turn away from my resident, if the rail is down, I put my hand on my resident. And now, so that you all can see what I'm doing, the towel that I had placed beneath her arm, I'm wrapping it over, and I'm going to gently pat the skin dry. Whenever I am drying the other areas, around sensitive areas, I can use the backs of my hand. Otherwise, it may feel like you're groping the resident. You still doing okay? I'm going to keep these towels and this bath blanket on you so that I can go ahead and I'll keep you warm. But now I have to turn you. All right? You still doing fine? All right, as I turn you, let me know if you have any pain. To turn someone who's unable to move themselves, I need to go ahead and get her. I'm going to lower the head of the bed a little bit more. I'm I'm going to grasp her shoulders, move her towards me, do the same for her hips and her legs. So now that she's closer to me, when I turn her, she won't be so close to the edge. A technique that I like to utilize is crossing the leg over, and it'll make sense in a few moments. All right, so we're going to turn you on the count of 3, okay? 1, 2, and 3. Miss Netta, are you still doing okay? So now I need to place my next towel. And this towel is going to prevent the bedding from getting wet when I cleanse the back. You can pull this back some because for this skill, we don't have to clean her rectum or her buttocks. It was the front and her back. The state of Florida or the Prometric CNA examination has another skill called perineal care, and that's when you clean your resident's genitals. So now that I have my towel and I've provided privacy by covering up areas that I will not be cleaning, I'm going to go ahead and wet my next washcloth. Wring it out well so that it doesn't drip on the bed, and apply 1 drop of soap. And ignore these tubes. Miss Netta is a training mannequin that allows us to take blood pressures. She also has respiratory sounds. So some of the tubes, wiring, and attachments that you see here, of course, they wouldn't be on a regular patient, but they're on Miss Netta. She helps us train our CNAs. And Miss Netta was donated to us by Jacksonville University, JU, who has a wonderful nursing program. So if you're interested in going further than CNA, we highly recommend that you research Jacksonville University. And again, thank you for the donations, JU. Miss Netta, you're still doing okay? Good. So now that I've washed the back, my 5th and last washcloth I'm going to use to rinse the back. Oh yeah, I know that has to feel good. We're almost done. So now that we've washed and rinsed, we're going to pat dry. And then for the state of Florida CNA examination, we apply lotion to the back. We perform a back massage. Circular motions. And the reason that you perform circular motions is to improve circulation, and plus she's been laying on her back, so in another of our videos we'll show you how to reposition your residents. Okay, and we have to remove that excess lotion. We want to provide the back massage, but we don't want to leave a wet area that can cause a pressure sore to form. So I'm going to remove my towel. Make sure there's no wrinkles beneath your patient as you lay her back. All right, so I'm going to expose you just for a moment so I can lay you back. Let's get you repositioned in the bed. You still doing okay? Great. So if you notice on my table, I have more towels and supplies than I needed, but I'd rather you have more than less. If you are using a bath blanket, you won't need as many towels. But I usually start off with 5 towels and 5 washcloths. Or if I'm using a bath blanket, I would have 4 towels, and one of my towels is on the table, of course. And then in addition to that, I'd have my 5 washcloths. Miss Netta, I'm going to let this rail up. I have to get your new gown. I can sit you just a little bit. Hey, Miss Netta, I have your clean gown. I'm going to start moving your bath blanket. Also placing that in the laundry basket. If you remember from last time, I just have to sit you up just a little bit so that I can tie your gown in the back. Make sure you're not on any wrinkles. I'm going to move you over just a little bit, okay? Oh no, I won't forget to put your glasses back on. I know you needed to watch a TV show. I haven't forgotten. I'm almost done. Here's your call bell. Is there anything else that you need at this time? All right, I'll make sure I come back and check on you in about an hour, okay? I'm gonna lower the bed. So my side rolls are up. My bed is now lowered. I'm going to pour out my water. So for the state of Florida examination, we don't store wet equipment or supplies. So I've rinsed it. I'm now going to dry it. If your items are stored in a cabinet, you have to use a napkin to open the cabinet. And now for the remaining items that you have, you can ask your nurse if she wants you to put those back into the supply area, but I'm just going to show you what we do in the real world. Take everything, roll it away from you, put it in the laundry basket. There's your table, Miss Netta. Take my laundry away. Now I take off my gloves like so, pinch from the palm and pull down, pinch and pull off, contain it. For your second glove, go under with 2 fingers. Go and wash your hands. Open your privacy curtain. If you have to document, your nurse will give you a documentation form. And that was partial bed bath for the Prometric CNA examination. Again, this is Nurse Eunice with Florida Training Academy. I wish you much success. If you want to see more videos, we have an entire playlist, and we also have an online CNA exam prep course. And right now you can get 50% off that course by using the promo code SPRING2024. Go to nurseeunice.com. I'll make sure I have that information in the description area. All right, everybody. All right. Have a wonderful day. And we will see you in the next video. Say bye, Miss Netta. Bye, y'all.
Good afternoon, Mrs. Jenkins. My name is Eunice. I'm your CNA today. I'm here to put on your compression hose. I'm going to begin by exposing your leg. I've already washed my hands and pulled your curtain for privacy. Ms. Jenkins, I just want to make sure that your stockings are free of wrinkles. I am now going to lower your bed, wash my hands. You have your call bell. Is there anything else I can do for you?
No, thank you.
Okay, I'm going to open the curtain. You have a great day.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.